Alrighty, we can start. Say when. Say good morning. My name is Councilor Chris Moyes, and I am the chair of the Board of Health. The board secretary has confirmed that we have quorum, so I'll call meeting 21 of the Board of Health to order. Again, welcome to those in the room and online. Today's meeting is being held by video conference and in person at City Hall in Committee Room 1. Because we are meeting in person and remotely, I will ask everyone for their patience with any delays and technical issues. If you are registered to speak at today's meeting, please listen for me to call your name. I will call speakers in the order they appear on the list. The list of speakers can be viewed online by visiting the Board of Health page at toronto.ca/council and clicking the speakers box for today's meeting. The board secretary has provided all agenda materials on toronto.ca/council and via CMP, the clerk's meeting portal. Directors, please keep your mic muted unless you wish to question staff or speak to an item, and ensure that your video is turned on. As part of each agenda item, I will ask directors to raise their hand or unmute their mic if they wish to question staff or speak. I will then create a speakers list and will call on directors when it is their turn to speak. When voting on an item or a motion, I ask that directors ensure that they turn on their video and to raise their hand to indicate their vote. Directors, I want to remind you that you must submit and approve your motions by email. Staff are available at boh@toronto.ca to help with motions. The Board of Health acknowledges the land we are meeting on is the traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. The City of Toronto acknowledges all treated people, including those who came here as settlers, as migrants, either in this generation or in generations past, and those of us who came here involuntarily, particularly those brought to these lands as a result of the transatlantic slave trade and slavery. We pay tribute to those ancestors of African origin and descent. Are there any declarations of interest under the Municipal Conflict of Interest Act? If you have an interest, please raise your hand or unmute your mic and indicate the item number and the nature of the interest. Seeing none, next we will need a motion to confirm the minutes from our regular board meeting on November 18, 2024, and our special meeting on December 8th, 2024, and December 19th, 2024. Councilor Bravo, Vice Chair Bravo, all those in favor, opposed, carried. So we have 7 items on the agenda today. For the first item, which is HL 21.1, election of chair for 2025 Board of Health, I'm going to cede their chair now to the board secretary to conduct this item. Do I need to move? Okay.
Oh, actually, yes, maybe you should. Yes, maybe you should actually. Yeah. Hello, members. Are there any nominations for chair of the Board of Health? Members may nominate candidates, including themselves, and nominations do not require seconding. Yes, Councillor Bravo.
I'd like to nominate Councillor Chris Moyse as chair of the Board of Health.
Okay, Director Alejandra Bravo has nominated Councillor Chris Moyse. Councillor Chris Moyse, do you accept the nomination?
I do.
I'm calling for nominations a second time. Are there any further nominations for chair? I'm calling for nominations a third and final time. Are there any further nominations for chair? Hearing no further nominations, I declare that the nominations are now closed. As Director Chris Moyse is the only nominee, I declare him as the chair of the Board of Health for a term of office starting January 20th, 2025 and ending December 31st, 2025 and until a successor is appointed. I will now ask Director Chris Moyse to assume the chair in order to conduct the election of the vice chair and the rest of the meeting's business. Thank you.
Thank you, Madam Clerk. Much appreciated.
Would congratulations be in order?
Thank you, Councilor Perruzza.
Congratulations.
Thank you, thank you. So good morning again, and welcome to our first Board of Health meeting. A new chapter in our ongoing commitment to health and well-being of Toronto's diverse communities. First, I want to thank my colleagues for once again entrusting me with the role of Board of Health Chair. It is a responsibility I embrace with unwavering dedication. Over the past 2 years, in collaboration with the diligent team of Toronto Public Health, we have chartered significant milestones across public health areas. As we begin this new year, I am eager to continue this collaborative work with both familiar faces and new members of our Board of Health. With that, I would like to formally welcome Councillor Lily Chang, Councillor Parthy Kenneville, and Councillor Anthony Perruzza. I see Councillor Chang is online, and Councillor Perruzza is in the room with us. Councillor Kenneville may join later. Also new to the Board of Health, Ida Lee Peretti, Toronto Catholic District School Board from Humber River Black Creek, is also online with us. You can wave if you like. Welcome, Ida. We are happy to have you here. And finally, I would like to acknowledge that this is our first board meeting with Dr. Nakoshi Lamte as our acting medical officer of health. So great to have you here as well. I'm going to clap. Thank you, Dr. Lamte, for stepping into this role. I look forward to working with you, as I have for the last 2.5 years. Today, Dr. Lamte will walk us through a year in review of Toronto Public Health, recapping some of our accomplishments from last year and setting the stage for the one ahead. We'll also receive an update from the Health and Homelessness Working Table, which was established back in 2023 to address health-related issues affecting individuals experiencing homelessness. Together, Toronto Public Health and a group of experts and individuals with lived and living experience of homelessness participated in a series of 8 meetings from August 2023 to May 2024. Their feedback is invaluable as we work to solve the homelessness crisis thousands of people across Toronto are facing using a holistic approach. And finally, we have some updates on the closure of safe consumption sites, the impact on emergency services, and the legal challenge being brought to the Superior Court of Ontario by TNG, the neighborhood group. On December 20th, 2024, following Board of Health direction, the City Solicitor's Office advised the parties to the TNG application of the Board's potential intention to intervene. Today, the Board will have an opportunity to hear from our legal counsel and decide on the best path forward to potentially support the challenge. As Chair, I remain committed to advocating for safe consumption and harm reduction services with recognition of the evidence backing these interventions and the profound impact on our communities. I will now hand it over to Dr. Lamte for her remarks.
Thank you, Mr. Chair. Good morning and Happy New Year, everyone. As this is my first Board of Health meeting as Acting Medical Officer of Health, I want to express my deep gratitude for the opportunity to work with the Board, City divisions, and my fellow Toronto Public Health colleagues in this new capacity. I also want to take a moment to thank Dr. Eileen Davila for her service as the City of Toronto's Medical Officer of Health over the past several years. Under her leadership, Toronto Public Health has made remarkable strides in advancing population health, reducing inequities, and protecting the health and well-being of those we serve. We are grateful for Dr. Davila's significant contributions to our community, including guiding Toronto's COVID-19 pandemic response, the largest vaccination campaign in our city's history, addressing the drug toxicity epidemic, and many other important public health initiatives. With some new faces around the table at the Board of Health, I want to introduce our current slate of directors who form Toronto Public Health's senior management team. In addition to Acting Medical Officer of Health, I will remain the Director of Decision Support, Surveillance, and Immunization until an individual is identified in an acting capacity. We are joined today here also by Dr. Michael Finkelstein, our Deputy Medical Officer of Health and Director of Health Protection, Myron Palasindaran, our Director of Operations and Business Services, who's joining us virtually today, Joanne Figliano-Scott, our Acting Director of Community Health and Wellbeing and Acting Chief Nursing Officer, Michael Blackburn, our Acting Director of Public Health Communications, Vanessa Fletcher, our Acting Director of Strategy, and Sana Imran, our Acting Director of Clinical Services. Together, our new leadership team has the opportunity to inspire innovation by cultivating an environment of creativity, collaboration, and open-mindedness, and I'm so pleased I get to work with them each day. Since the Board of Health convened in November, Toronto Public Health has launched the Downtown Community Outreach Response and Engagement Team, or Downtown Core Team Pilot, in the Yonge and Dundas area. This is a collaboration between Toronto Public Health and the Toronto Police Services. The Downtown Core Team will proactively connect vulnerable individuals to services such as primary care, mental health, and social programs. Nurses also provide short-term case management. The program is led by a team of public health nurses and will be supported by a primary health care specialist. The primary role of officers from the Toronto Police Services is to support and enhance the safety of public health professionals when identifying and interacting with vulnerable community members in the area. As a chair of the Student Nutrition Ontario Toronto Partnership, Toronto Public Health supports student nutrition program oversight and coordination. It has a lead role for nutrition and food safety expertise, in addition to coordinating the annual government grant application process. In 2024, Toronto Public Health championed the first public school expansion of the program since 2018, resulting in $2.6 million in additional funds to support 23 new student nutrition programs, reaching an additional 8,000 students in Toronto. These important programs are run locally by parents, volunteers, and students, ensuring students have access to safe, culturally appropriate, and nutritious food during the school day. Evidence shows that when students eat healthy meals at school, they develop greater nutrition knowledge and healthier eating habits, focus better, score higher marks in reading, math, and science, and are more likely to graduate from high school. On January 2nd, the Government of Ontario announced the approval of Toronto Public Health's Homelessness and Addiction Recovery Treatment Hub, or HEART Hub, with the application to establish a site in the downtown core. However, we are still waiting to hear from the province about the total financial support that will be made available and the scope of the project, which will impact the services Toronto Public Health is able to offer. The Downtown Heart Hub will aim to facilitate access to essential healthcare services for people who use drugs, including improved access to treatment and wraparound support such as housing. As we look back at 2024, Toronto Public Health faced complex challenges, made tough decisions, and worked to protect the health of our diverse communities. As we embrace the new year, it brings a sense of renewal, opportunity, innovation, and potential. Looking ahead, we'll continue to advance our key priorities using the 2024-2028 strategic plan as a blueprint to deliver impactful public health programming and core services. I look forward to what we will achieve together in 2025. Thank you.
Thank you, Dr. Lamptey. And now we'll go to the next item, which is HL 21.2, election of vice chair for 2025 Board of Health. Is there anybody here to speak on the item? Members, are there any nominations for vice chair? Members may nominate candidates, including themselves, and nominations do not require seconding. I'm going to nominate Alejandra Bravo for vice chair. You accept? Okay. Any other nominations? I'm calling for nominations for a second time. Are there any further nominations for vice chair? I'm calling nominations for a third time and final time. Are there any nominations for vice chair? And seeing none, you've been acclaimed as vice chair. Would you like to say a few words? You don't have to.
Thank you, Mr. Chair. Just look forward to supporting you and the board and the work that we have ahead.
Thank you so much. Okay, we'll now review the rest of the agenda. So item HL 21.1, 2025 Board of Health Committees and Appointments. Would anyone like to hold this item? No. Okay, we have a motion, right? Oh, we do have a motion because I prepared it. Should we just move it now, or? Yeah, I'm just going to move it now. Yeah, I do want it on the screen. Okay, this is the motion for committees. I've spoken to all the members here on this item, and they've all said yes. So I'm going to, all those in favor? Opposed? Carried. Item as amended, all those in favor? Opposed? Carried. Thank you. Item HL 21.4, 2024, a year in review of Toronto Public Health. There is a presentation, so I will hold this item down in my name. HL 21.5, feedback from Toronto Public Health and Homelessness Working Table. There's a registered speaker on this item, so I'll hold this down. HL 21.6, anticipated service impacts for Toronto Public Health and emergency responders due to the closure of safe consumption sites. This item has 2 supplementary reports with confidential attachment to it. And I believe we have registered speakers on this item too, so I will hold this down. Item HL 21.7, enhancing food and safety at special events. You want to hold this down? There are questions? Okay, I'll hold this down. Okay. I do want to make one change to the agenda, though. Can I do it now? I do want to move item. Oh, you put it in here. I do want to move item HL 21.6 as the last item. Okay. Well, because we have to go into private, in camera, sorry, for our legal advice. I just want to.
Yeah, so I appreciate that, but we have a number of speakers here. Is it possible to allow them to speak and maybe move this up, and then the in-camera discussion that we have to have that's internal to us?
Yeah.
But we're sitting, waiting all day.
Okay.
I think I was going to ask, Mr. Chair, that if we could move this as the first item as opposed to having the presentation from staff, only because they're all here waiting. I'm just wondering if we could do that. We don't have a large list of people to speak, but that is a large item that people want to speak on. I'm just wondering if we do that first.
Yeah, that's fair. We can do that. I'm flexible.
Okay.
We could, but then I will hold it down.
Right, and we can do
then
the
we will go
cameras.
into private in the end.
Right, I think it's easier for everybody here as well.
Okay.
Because they would have to wait an inordinate amount of time, and I think it's easier to facilitate that.
Okay, is everyone okay with that? Okay, we'll do that then. Okay. Can I have the speakers list? Or a copy of the speakers list? Thank you. Okay, we will shift the agenda around. We'll go to item HL 21.6. Just give me one moment. There was no presentation on this item, right? Okay. Okay, the first speaker is Diane McNally. Are you here? Also, too, the issue is people may realize that this is further on the agenda, so they might be here.
I was going to say that, Mr. Chair, that if people who have been watching think that it'll come a bit later, we probably should call through and then they'll hop on afterward.
Okay.
We could go through the list now, and then since it's already on the agenda like this, and then call people again from the top.
Yeah, okay. Candace Casana, are you here? Okay. Callum Houston. Okay, you have 5 minutes. Go ahead.
Yeah, so my name's Callum Houston. I'm from Don Valley East, and I just want to thank the councilors here and board members for hearing me speak. Also, I'd like to just say that there are deputants who are coming. They thought the item was later, so they might not be able to speak if they don't make it in time.
Just point of order, Mr. Chair. I'm new here and I want to understand it. So the agenda gets published 9:30, right? The items get listed in order. There are no timed items, right? So you get to item 6. You can get to item 6 at 9:31, correct? Okay, so
No,
that's
that never
basically the way it works, right? So,
I'm being because of the importance of this.
No, no, and I understand that, but I just wanted to get clarity on that because it's not like there's an expectation that this was going to come up at 1 in the afternoon or something, right?
No, I understand that, but again, today we're making some exceptions because of the importance of this particular item. It's come back many times, and it's a very sensitive issue, and so I'm giving some leeway on this particular item, okay? So what
Are you going to have a cutoff with respect to the times that people can actually register to speak? Because as been stated, this gentleman has just stated there are numerous other people that are supposed to be coming. Are we just going to be facilitating and having it wide open, or are you coming up with a cutoff time?
Yeah, today we actually haven't moved the motion to actually cut off the speakers list. In other circumstances, in previous meetings, we have cut off at 10 o'clock. We didn't do that today.
So if 20 people comes at 11 o'clock, you will actually entertain them?
Technically, yes,
Okay,
but I
that's
don't
fine.
anticipate that.
I know what I will do then at that time.
Okay. Okay, I'm going to reset your time.
Thank you.
Callum? You have 5 minutes, go ahead.
Yeah, so thank you for having me. I'll just get started. We're asking, so I'm an organizer with Harm Reduction Advocacy Collective, which is a group of people who use drugs, harm reduction workers, activists, and just community members who are dedicated to supporting people who use drugs and keeping the safe consumption sites open. And we're calling on the Board of Health to take urgent action in establishing an emergency table with a mandate to plan for and respond to the public health emergency crisis, the overdose crisis that we're in, as these will be escalated due to these site closures. This table, we want the table to be established by the end of January, to be co-chaired by city and community representatives, involve the perspectives and experiences of people who use drugs every step of the way, and meet on a regular weekly basis to reflect the scale and urgency of the crisis that we'll be facing. We're also asking for a reassembly of the emergency task force, specifically for addressing the toxic drug poisoning crisis. We'd like to make sure that you guys go forward with the intervening in the upcoming charter challenge as well. And if there's an injunction, we'd like a commitment to providing support for safe consumption sites at either the Works new location or any other, if there's any spaces like sites that are outside of the 200-meter zone to continue funding these sites. There's going to be a lot more demand on emergency services, and we need to make sure that we're properly investing in these services, including safe consumption sites. Otherwise, everyone is going to be overburdened. My last request is that the scope of what emergency services are that'll be impacted get broadened, because in the report, the only service providers that were included were police, emergency responders, and firefighters. But there's a lot of other services that will be impacted by this. And they're not necessarily emergency services, but they are services that people depend on and will be overburdened, such as the TTC, places like, food banks will be overwhelmed, even though they already are, as well as drop-ins and even the shelters, which are going to be the first places that are overwhelmed. Suffice to say that that's pretty much everything in terms of the asks, and I won't take up any more of your time. Thank you.
Thank you, Callum. Any questions for the deputant? Seeing none, thank you for coming in today. Next up is Megan White. Are you here? Megan White? Okay. Diana McNally, I heard you're online. You want to unmute?
Okay, here I am. Can you see me, hear me?
Here we go. You have 5 minutes, go ahead.
Thank you. So, while not every overdose death is of someone who is homeless, and not every person who is homeless uses drugs, we know that there is a disproportionate impact of the toxic drug crisis on people without housing and people who are street involved. So, in 2023, 525 Torontonians died as a result of toxic drugs. That's a lot of people. 42 of those deaths occurred in a shelter or a 24/7 respite. And based on what I have surmised from the City of Toronto's data, at least 60 homeless individuals died of toxic drugs in 2023, meaning at least 18 people died outside of a shelter or respite setting. Now, there are another 57 deaths that have no attributable cause, but many of them likely were also the result of overdose. We have no numbers as to how many people who are low income and street involved and who have previously and even recently been homeless have died from toxic drugs. This is all to say that we don't know the full scope of the impact. More specifically, we don't know who is dying in the population of people that I work with in the City of Toronto's daytime drop-ins. Our spaces are the only social service used exclusively by homeless people in shelters, encampment residents, and unsheltered people, as well as low-income and street-involved people. We are a net that catches that entire population. And before we had safe consumption sites, daytime drop-ins were safe consumption sites. I say this because I lived it as a frontline worker. Before safe consumption sites existed, reversing overdoses was a central part of my work in a drop-in. But unlike a staff person in an SES, it wasn't my dedicated role where I could closely monitor people using drugs. And instead, it's something I would catch while making my rounds or when a community member would run to come get me. This means that I often found people too late to prevent serious injury to their organs, including to their brains, through oxygen deprivation. And I have to say, when you find somebody who's blue in the face and you're scraping the vomit out of the inside of their nose to spray naloxone, it's unpleasant. It's very, very unpleasant. And the worst moment of my life was having to perform CPR on one of my own peer workers. He lived, but I was forced to break his rib cage and feel what it's like to push directly down on his organs through the floating bones of his chest. You have to know that it isn't just dedicated emergency responders who will be impacted. It's people like me, workers who will have to take on saving lives at the sides of their desks, with no supports for the trauma that this will entail, no resources for community members who witness these events, and who themselves are often first responders. So when supervised consumption sites close, drop-ins will once again become your de facto overdose prevention sites. I know this because I've experienced it. The city needs to do more than request policy reversal from the province. We need a comprehensive plan to support this inevitable transition. And this is why we need, as per Deputant Callum Houston's request, the reestablishment of the emergency task force and the creation of an emergency table. Thank you.
Thank you, Diane. Any questions for the deputant? Seeing none, thank you. John Sewell, former mayor of Toronto, 5 minutes.
Thank you, Mr. Chairman. This is an issue that I've been involved in for the last 10 years. In 2015, David Crombie and I got together because we thought that Toronto needed some safe consumption sites. We brought together a group of about 40 prominent Torontonians to argue that case. And in fact, we got the city to, in fact, establish its first consumption sites. And since then, I've been very interested in the issue. And of course, as soon as I heard that the province is coming in with legislation, I got together with David Crombie again. And again, we brought together a bunch of people who made some public statements at the beginning of October. More recently, David and I sponsored a public meeting a week ago today, actually. Mr. Chair, you spoke at that meeting, a very well-attended meeting to try and argue that we have to reverse the provincial legislation. In my mind, the first thing the board has to do is agree to be an intervener in the court challenge against the legislation. The legislation has two impacts. First, it has a devastating impact on the lives of people in Toronto and in fact in Ontario. Getting rid of consumption sites is just a major blow. It's going to cause a lot more people to unnecessarily die. And obviously, as the Board of Health, that's something you have to be concerned about. I mean, one of the points that was made at the meeting on last Monday was that more people have died of drug overdoses in Canada than died of COVID. And think of all the resources we put into COVID. So that's one. But the second aspect is that the city's powers about addressing health concerns are actually being taken away by this legislation. So it's a direct attack on the city's power to actually deal with issues. Just the one issue that's in the board of the staff report is not being allowed to give out clean needles. Absolutely astounding that a government would do that. So what I want the board to do is to agree today that you're going to intervene in the court challenge. I will say that the judge had set last Tuesday as the day for interventions. Barbara Hall and I, as former mayors, have both intervened. I'm not sure the court has allowed our intervention at the moment, but our lawyer has argued the case. Because the city hadn't taken a position, the court said, okay, I'll put it off until the 24th for the city to make a decision. So it's really important that the board today say, we're going to intervene in that legislation. If the board does not intervene, in my opinion, that's a real black mark against the city in not responding to a very, very serious health concern. So that's the key recommendation I'd make with you today. Agree to intervene in the court challenge. Instruct the city solicitor to do that. Or if you don't want to do that, instruct the city solicitor to get outside counsel in order to do that. I find it interesting that the provincial government in this case are not using its own lawyers. They've gone out and get outside counsel to work with them. The city could do that if you don't want our own legal staff to do it. So that's my recommendation. I certainly agree with the arguments about an emergency table, but the key thing right now is to get rid of that legislation. As we know, the likelihood of a court challenge to succeed is very, very likely. Supreme Court of Canada has made a very strong decision in the Insight facility in Vancouver in 2011. It could clearly support this. So please do that. Thank you very much.
Thank you, John. Any questions for the deputant? Seeing none. Thank you for coming in today. And thank you for your passion on this issue. Justin Niera Ariza. No? Online? Here we go. 5 minutes, go ahead. We can see you, but we cannot hear you though.
Hear me?
Yep, now we can.
Okay. Thank you to the Board of Health for allowing me to speak today. My name is Justine Arisa. I'm a healthcare provider, community member, and constituent of the city in Ward 9. I am here to speak to the item anticipated service impacts for the Toronto Public Health emergency responders due to the closure of supervised consumption sites in Toronto. I would like to echo many of the words that my fellow peers have said before me. I've sat before this board multiple times over the last few months, along with many community members and peers. For the last few months, we, including members of this board, have talked about and acknowledged the emergency that we are in. We agreed on the negligence of Bill 223, putting 1,000 more lives at risk, a risk we cannot afford as we have lost far too many. We emphasized how vital and imperative safe consumption sites are and harm reduction services are across our city. We have set motions, made recommendations, and shared stories, yet here we are once again with little to no action. I acknowledge the recommendations made by the Board of Health for today's meeting and their urges to the government of Ontario. However, this is not enough. We have little to no answers about how the Board of Health is going to fight and strike forward amidst the drug toxic crisis, the province's war against people who use drugs, and the services that meet them where they are at. We have no insight to how the Board of Health is ensuring that their own safe consumption sites continues to run. We've had no explanation on how the Board of Health will support safe consumption sites that will remain open in our city past March 31st and the surge in services that will come and use that will come. We have no clarification of what happens to the remaining of harm reduction programs, such as access to sterile equipment and drug checking services. We are quite literally feeling like we are blind at this moment in time. At last, we find ourselves completely at a loss of action and understanding of how the Board of Health is going to hold itself accountable at a time of complete negligence from the provincial government. So, as a community member, we have gathered here to present you with the following demands. 1, reassemble the emergency task force for addressing toxic drug poisoning crisis. 2, move forward with being an intervener in the Charter Challenge. And 3, full support and advocacy for a resource to be put into keeping the works open and all harm reduction distribution flowing if the injunction is successful. Again, I would like to highlight that today's item is all about anticipated and impacts to emergency responders due to the closure of safe consumption sites. We know that over 11,000 overdoses were reversed in safe consumption sites across Toronto just between the years of 2020 and 2024. 11,000, a number that I know we're all quite familiar with. We know that the scale back of harm reduction services, including distribution of new sterile kits and needle exchange programs, will result in an increase of chronic and blood-borne infections for an already vulnerable community. Outreach workers, drop-ins, community health centers, service providers across the sector of mental health and substance use are undersourced and underfunded. Heart hubs will be no different. We need funding that acknowledges and supports the evidence gathered for decades about already existing and life-saving healthcare. First responders and hospitals are going to be inundated once these sites close. Board of Health has provided all the information outlining just how dangerous this will be. As a community, again, we call on the Board of Health and Toronto Public Health to 1, take urgent action to establish an emergency table with a mandate plan and to respond to the public health emergency that will be caused by the site closures. This table should 1, be established by the end of January. 2, be co-chaired by the city and community representatives. 3, involve perspectives and the expertise of people who use drugs and people who support people who use drugs. And 4, meet regularly. We suggest weekly to reflect the scale and the urgency of the crises that we are in. Lastly, I would like to ask, how is Toronto Public Health preparing for the anticipated increase in public drug use once sites are closed? Public spaces are going to become unsupervised consumption sites. Public bathrooms aren't equipped with sharp boxes, and possibility and need for dose response among those staff responsible in these spaces. City of Toronto staff, people working in cafes, public spaces such as transit, libraries do not have the tools that safe consumption sites and workers within do. This decision is forcing the public to become first responders because the first responders will not have the capacity to respond to every call. And an overdose, every second, every minute, it's vital. People deserve to live, and the city is responsible for the safety of every single one of its constituents. We need you to step up. We need you to act now. We're in an emergency. We know that this can be done. Please, please, please step up.
Yeah, thank you. Any questions for the deputant? Seeing none. Thank you for coming in today. Up next is Rhiannon Thomas. Are you here? Rhiannon Thomas? One online?
Hello, can you hear me?
Yes, 5 minutes, go ahead.
Okay, great. Thank you for having me speak here today. My name is Rhiannon Thomas. As you know, I currently work in an emergency department and have spent over 20 years working with people who use drugs in this city. I'm here to echo the concerns about the emergency response to the closures at the last meeting, the December 19th meeting. I'm also a member of the Our Health, Our City implementation panel, who Dr. Davila mentioned at the December 19th meeting as potentially an avenue to deal with this urgent issue that's coming up of the closures. That committee is for implementing the new mental health and substance use strategy, not an emergency response, but there are many members who have lots of expertise around that table. And in fact, many of the members of that implementation panel have voiced concerns about the lack of response by the city. I don't think I need to speak about the impacts. The board will hear the report from Toronto Public Health. And some of the other speakers have talked about that. One point someone just brought up is around drug checking, and that service that comes out of St. Mike's is a key place where we receive information about what is in the toxic supply on the street and actually can direct, treatment, prescriptions, all these kind of things that are around, reducing the impacts of the crisis that we're facing. So again, I'm here to say, our city needs critically and urgently an emergency response planning table. This planning table needs to include not only emergency responders, but emergency department representatives from hospitals, community organizations, as some of my fellow speakers have mentioned, housing providers, and people who use substances, others who are deemed as appropriate. As many people have said, there's going to be much more public use, cafes, public bathrooms, all of these things. Essentially, we need to have people at that table who are most likely to be responding to these increased overdoses. Today is 10 weeks until the closure of these sites. 10 weeks. That is 70 days from today until every single overdose that was prevented in those consumption sites will not be reversed. 70 days until we start seeing increased deaths in our city. And as one of my fellow speakers mentioned, responding to an overdose is terrifying. I can't describe it to anyone who's never seen it before. And this will be a huge impact on the public, people who work anywhere where there's a public bathroom. And people of our city are just not going to be prepared for that. So again, I'm here to call on the board today to continue to do the right thing in prioritizing support on this issue. And I ask that you direct the appropriate city divisions and departments to convene an emergency response table immediately to plan how we can address the projected impacts in advance of these closures before this happens and before we start to see all of the impacts and devastation that this is going to cause in our city. Thank you.
Thank you. Any questions for the deputy? Seeing none. Thank you for coming in today. I'll go back up to the list, top of the list. Candice Casano, are you here? Okay, come on up. You have 5 minutes.
Hello, thank you to the Board of Health for welcoming me today. My name is Candice Casano. I currently work as a case manager for a harm reduction supportive housing program and have worked as an overdose prevention worker at one of the supervised consumption sites slated to close. I'm also a member of the Harm Reduction Advocacy Collective. It feels maddening to have to be here today, to be quite honest. I'm not sure what I can say to highlight how devastating these closures will be that hasn't already been put forth by various medical associations, unions, social service agencies, CHCs, frontline workers, community members, and people with lived experience, harm reduction advocates, journalists, and both provincial and municipal reporting. Some days it feels like we are just yelling ceaselessly into the void. We know the Board of Health understands the issue to some extent, as they have chosen to support the Charter Challenge launched by TNG and are willing to sign on as interveners. But what's not clear is what exactly the plan is to manage the very real public health emergency that is about to occur when SCSs close. The 22,000 overdoses that have been responded to by SCSs in Ontario, resulting in 0 fatalities, will not magically stop happening when the clock strikes midnight on April 1st. Heart hubs will not cure the problem by simply referring out to public detox and treatment services that barely exist to begin with, and for which Ford has not offered up any fulsome plan for expansion. Instead, overdoses will be occurring much more frequently in public, on sidewalks, in schoolyards, alleys, in shared bathrooms, libraries, cafes, etc. Anticipated service impacts on fire, police, and paramedics have been explored. When you and your loved ones require emergency care, response times will be through the roof alongside ER wait times. But what about the impact on other community services? Drop-ins, shelters, supportive housing sites, CHCs will all be overrun with overdose response, crisis management, and grief support needs that are beyond untenable. The breaking point is already here, and this lack of planning and leadership on the issue will cause a mass casualty event. There is a bigger question to be explored about the very real psychological impact of this devastation and the message we are sending about who we are as a society when we sidestep our way around caring for other people's lives. No one comes to an SCS because their favorite way to get high is in a medicalized environment under the watchful supervision of a team of overdose prevention workers, RNs, and health promotion staff. People come to SCSs because they want to live, and they know the simple fact of their being alive is valued in these spaces. Removing SCSs with no plan for the fallout tells everyone who uses drugs that it's okay if they die, even encouraged. You've heard my comrades refer to this negligence at these meetings and elsewhere as social murder. I'll remove the qualifier and call it murder, plain and simple. If Ford, Jones, and their allies were being honest with us, they would admit this plan amounts to the desire to kill off those that their ostensible fiscal conservatism finds too draining on the system. The fact is we don't have a plan for the bodies, and they are about to pile up. This isn't fear-mongering, this is basic math. We call on the Board of Health and Toronto Public Health to firstly take urgent action to establish an emergency table with a mandate to plan for and respond to public health emergency that will be caused by site closures. We call for this emergency table to be established by the end of the month, be co-chaired by city and community reps, center the perspectives and experience of people who use drugs, and meet regularly, ideally weekly, to reflect the scale and urgency of the crisis. Secondly, we call for needle exchange services to exist within heart hubs. We cannot have preventable diseases like HIV, Hep C, or abscesses and other ailments caused by the sharing of needles and harm reduction supplies backing up our already strained ERs. We cannot follow Saskatchewan's lead and watch HIV rates rise over 70% in the years after limiting access to harm reduction as if we had no conceivable idea what would occur. Third, we call for Toronto Public Health to follow through on their commitment to act as interveners and to advocate to keep the works open. Before I close, I want to take a moment to honor some people in my world who have passed on as a result of this crisis. Sally, John, Steph, Mark, Alexis, Michelle, Dan, Eddie, Dees, James, and also want to send love to our comrade Charlene. You are loved and missed every day, and we will never stop the fight. Thank you to the Board of Health for having me today.
Thank you for your deputation. Any questions for deputant? Seeing none, thank you. The last on my list is Megan White. Are you here? Megan White? No? Okay. I'm going to hold this item down, as I mentioned previously, and we'll move on to item HL 21.4, 2024, a year in review of Toronto Public Health. We will begin with the presentation on this item, and I'll ask Dr. Lamptey to start.
Thank you, Mr. Chair. Each year, Toronto Public Health is required to publicly report on programs provided to residents as part of the Ontario Public Health Standards. This past year, Toronto Public Health entered a new chapter, emerging as a post-pandemic organization with a renewed commitment to adapting and improving to best serve the diverse needs of our city. Next slide, please. In addition to providing core public health programs and services, Toronto Public Health developed a strategic plan, launched new initiatives and resources, and enhanced partnerships with city divisions and the community. This report provides you with a summary of our accomplishments and achievements in 2024. Next slide, please. Toronto Public Health is the largest public health unit in Canada, protecting the health of over 3 million people in Toronto. In July 2024, the Board of Health adopted the Toronto Public Health Strategic Plan 2024 to 2028. Toronto Public Health's mission is to protect and improve health at a population level while reducing health inequities. While the healthcare system works downstream, curing and caring for individuals, our focus in public health is upstream, preventing diseases from starting in the first place by addressing them at their source. Public health recognizes that many health problems, chronic diseases, mental health and substance use challenges, challenges of child growth and development, and even many aspects of communicable disease control cannot be solved one person at a time. The strategic plan will serve as our guiding blueprint with 5 key priorities to protect and promote health at a population level. We will now cover each strategic priority and key actions and accomplishments in 2024. Next slide, please. Each day, Toronto Public Health protects the health of Torontonians through interventions like ensuring the safety of food and drinking water and preventing communicable and chronic diseases. In 1913, that public health work might have looked like a milk inspector assessing the safety of milk, while in 2024, that may look like a member of our Dine Safe team inspecting your favorite restaurant. Public health works by assessing and measuring the causes of ill health and taking action to improve the conditions for positive health. Illustratively, in 2024, Toronto Public Health provided 155,000 oral screenings for elementary students across Toronto. Toronto Public Health also completed over 28,600 inspections of food premises. More than 42,000 children and youth were vaccinated by Toronto Public Health staff in both the Student Immunization Program and Immunization School Pupils Act assessments. We also created a new online vaping hub for parents and students with resources to help support prevention and cessation of vaping among youth. We also assessed and reported the respiratory situation and risk through an updated respiratory dashboard that integrates multiple data sources, including wastewater. We also updated our wildfire smoke response strategy, which includes seasonal updates and preparedness activities. Next slide, please. Toronto Public Health works to ensure that people of all ages can live healthy lives, from optimizing health for children and youth to promoting age-friendly communities for older adults. Simply, public health aims to foster a healthy life start, healthy growth, and healthy aging for as long as possible. This includes promoting healthy living through physical activity and nutrition, and advocating for conditions that improve health for residents like clean air and green space. For example, in 2024, we submitted a report on healthy aging to the Board of Health, making recommendations to work with partners to make our city age-inclusive, age-friendly, and age-equitable. We also implemented the Into Kids Health Initiative and supported Toronto's student nutrition programs, which provide meals and snacks to over 235,000 students each school day. We also were successful in expanding access to our breastfeeding services. Next slide, please. Toronto Public Health advances policies, programs, and partnerships that aim to improve mental health and well-being and reduce the health and social impacts of substance use-related harms. In 2024, the first Our Health, Our City Strategy annual report was issued, and we also established the Our City, Our Health Strategy Implementation Panel. As I mentioned in the opening remarks, we collaborated with partners to pilot the downtown core team, and TPH staff at the Works Harm Reduction Program collected and safely disposed of 358,480 needles, engaged over 17,200 clients in the supervised consumption site, provided over 77,000 referrals, and responded to over 658 overdoses. Next slide, please. In 2024, TPH also advanced initiatives to promote health equity across Toronto's diverse communities. We have some examples here, including the establishment of the Indigenous Wellness Committee in partnership with the Toronto Aboriginal Support Services Council. TPH refreshed several population health status indicators with socio-demographic characteristics and geography on an interactive dashboard. These updates will be completed in early 2025. And TPH also launched a team to work with Ontario health teams in primary care to collaborate on common objectives. Next slide, please. 2024 heralded many events in our organization, including the reinitiation of the Hastings Lecture Series, Diverse Dialogue, Stigma, and Breaking Barriers, as well as the provision of professional development and wellness initiatives for staff, including bi-monthly leadership talks and training and certification courses. I must know as an organization, 2024 was also one in which we had to navigate a lot of transition and change. Many staff relocated from our offices at 277 Victoria Street to Union Station. More staff will also be relocating this year to Metro Hall. We also said farewell to Dr. Davila and many members of our senior management team, and we wish them well. Next slide, please. Ultimately, strategic priorities and actions aim to impact outcomes, and we have many examples of positive organizational outcomes we can point to, and here's a sampling of some of those achievements. Beginning in the fall of 2023 and continuing through the fall of 2024, TPH assessed students born in 2016 from all public school boards as part of the Immunization of School Pupils Act requirements. Over 22,000 students were assessed, and at the start of the assessments, 28% were up to date with their immunizations and in compliance with the Immunization of School Pupils Act. At the end of the assessments, the overall reported vaccination rate increased to 90%, and compliance with the ISPA increased to 98%. This represents tremendous efforts from all stakeholders, including Toronto Public Health, schools, parents, and primary care. Toronto Public Health also enhanced vaccine access to Indigenous communities by organizing and scheduling 6 vaccine clinics in partnership with Indigenous-led community agencies. TPH also partnered with TDSB on schools with a high number of Indigenous students to reduce Immunization of School Pupils Act suspensions, resulting in a 46% reduction in school suspensions 10 days before the suspension period. In our tuberculosis program in late 2023, TPH implemented an online self-reporting tool for newcomers requiring tuberculosis medical surveillance. 6 months following implementation, our clients reported that 64% of them preferred to report self-online, and this decreased the number of inquiries about the status of medical surveillance by 94%, freeing up staff time. We're also very proud of the fact that in June 2024, the Toronto Public Health Communication Team won the Award of Excellence in Government Communications for the MPACS campaign and an award of distinction, naming TPH Communications as Communications Department of the Year. Next slide, please. The COVID-19 pandemic brought attention to public health and highlighted pre-existing and widening inequities coming out of the pandemic. The challenge of misinformation and disinformation underscores how it's important and critical for us to continue to build and maintain trust with the public. As we move into 2025, Toronto Public Health will continue to advance our strategic priorities and objectives. Thank you, Mr. Chair.
Thank you, Dr. Lamptey. We do have speakers on this item. Jason Stevens, are you here? Okay, online.
Hi, Councillor Moyes. Can you hear me?
Yes, we can. 5 minutes. Go ahead.
Okay. First of all, hello, good morning, shalom. Congratulations, Councillor Moyes, on your appointment as chair of the committee, and Councillor Bravo as deputy chair. Trying to face the, turn on the video so you can see me.
It's okay, as long as we can hear you, and we can hear you just fine. We can see you now. Go ahead.
Okay, so thank you. Let me introduce myself. My name is Jason Stevens, and I'm a McMaster University science grad. I got involved in health-based nutrition and health when I started a business in 2004 called Jay's Gourmet, where I delivered plant-based meals across the city. Let me also just say, first of all, it was a pleasure to meet Councillor Moyes. I think I met you. It was an absolute pleasure to meet you at an event where Dr. Marcus Garvey Jr. was speaking at the North York Library. And I recently got to meet Councillor Cole at James Pasternak's Hanukkah event at City Hall. Pleasure to meet all of you and the members and public attendees. My concern and my recommendations around health in the City of Toronto, I have a positive example, stem from my own experience where in 1998, I was diagnosed with diabetes, and I managed to reverse my diabetes by going on a plant-based diet. I didn't grow up in a community in Willowdale or in a family where a plant-based diet was very popular. However, after reversing diabetes, I obviously stand wholeheartedly in support of the city taking measures to improve and increase the, let me make it simply, having kids and the population eat more veggies. I'm currently a candidate for the Toronto District School Board in Don Valley West. I also married a registered nutritionist, and I've studied CPR, and I've been studying nutrition for the last 20 years just independently. One of the books that and tomes that influenced me greatly was written by John Robbins, the nephew of the Baskin-Robbins empire. And he turned down the entire dairy industry and a billion-dollar inheritance to end up in California, going vegan, going plant and preaching or proselytizing plant-based diets across America. And if I believe very strongly that a plant-based diet and encouraging the city's institutions to move in that direction is absolutely essential for the health of our community. The federal government in the last few years managed to change the Canada Health Guide and shift away from meat and dairy as main items of nutrition and increase the amount of plant-based vegetable foods that we should be eating in our diet. Really, you know, I can cite the Hippocrates Health Institute, a group of doctors in the U.S. and academic literature, but I think I like the examples of common sense and the sort of low-dangling fruit examples that teach us why a plant-based diet is so healthy. Gorillas, whose DNA are similar to humans, are vegan. Elephants are completely plant-based. Hippopotamuses are completely plant-based. Such healthy, strong animals. I don't know where I am in my time, but so in terms of the City of Toronto, and I'm so glad the public health officials are here to be able to let me say how much I support a plant-based diet, how much the American Standard Diet, or SAD, Standard American Diet, has not been beneficial to our nutrition, our overall health. And I will answer any questions. Again, I'm a McMaster grad. I used to work for the NDP cabinet minister, David Christopherson, years ago. And I hope to use these positions to improve the health of my loving community and the loving Toronto I live in. Thank you, councillors.
Thank you, Jason. Any questions for the deputant? Seeing none, thank you for coming in today. It's nice to see you again. Therese Dinnen, are you here? Okay, 5 minutes.
Is this on? Yeah. Toronto Public Health accomplishments in the 2024 review highlights the creation of Toronto Public Health's 4-year strategic plan. During the plan's consultation process, hundreds of Torontonians expressed concerns regarding actions taken by Toronto Public Health during the WHO's pandemic, including the enforcement of unsafe and ineffective COVID-19 injections. Unfortunately, in a letter dated January 13th, 2025 from Toronto Public Health to parents and guardians, it's clear that COVID-19 injections continue to be pushed onto children. At the last Board of Health meeting, Councillor Thompson asked Dr. Eileen Davila if she had concerns regarding the safety of vaccines, and he inquired about safety studies. Dr. Davila said there is a process at the federal level that vaccines have to go through before they become licensed for use in Canada. And Dr. Lamptey said Health Canada does review the evidence from clinical trials, whether the vaccine is effective and how it's safe in terms of side effects and which group it works in. If Health Canada reviewed documents from the clinical trials of the Pfizer COVID-19 vaccine, then Health Canada would have known that Pfizer's language in the documents includes vaccine failure and failure of efficacy. They would have known that Pfizer was aware that the third most common adverse event from their vaccine was COVID. They would have seen that Pfizer manipulated the data, for instance, removing people who were vaccinated and died from COVID. Health Canada would have known that Pfizer was aware that 1,225 people died within 3 months of the rollout of their vax, and by April 2021, Pfizer was aware that children's hearts were being damaged, and they knew this was not a rare and transient side effect. If Health Canada reviewed the evidence from Pfizer's clinical trials, they would know that Pfizer documents indicated an increase in maternal deaths by 40% because women were hemorrhaging due to degrading placenta during pregnancy. And the testes of male baby boys is degrading, therefore affecting the normal growth of boys into men. These clinical trial reports are just a few of the 50 shocking reports in the book, The Pfizer Papers, Pfizer's Crime Against Humanity. The information in this book is available to the public because the FDA was sued and subsequently ordered to release 450,000 of Pfizer's clinical trial documents. Today, Pfizer's being sued by the Attorney General of Texas for misrepresenting COVID-19 vaccine efficacy. And all COVID vaccine manufacturers are being investigated. These investigations concerns potentially fraudulent activity that falls outside the scope of legal immunity granted to manufacturers of the COVID-19 vaccine. A question being asked by the authors of the Pfizer papers is, can any blame be attributed to government leaders and elected politicians who knowingly suppressed or falsified information for pharmaceutical companies about the vax harms just to achieve political advantage? Today, health boards and districts in the US and other cities around the world are making decisions to cease all COVID-19 vaccines due to safety concerns. I'm asking Toronto's Board of Health to do the same, to stop providing and promoting the COVID vax in public health clinics and other facilities and schools across the city. Can I get the overhead, please? If there is a benefit to the COVID-19 mass injection campaign, it's that more Canadians are now questioning the safety of all vaccines. I shared at the last Board of Health meeting that Dr. Anthony Fauci and the Department of Health and Human Services in the US admitted there were no pre-licensing placebo-controlled safety trials for any of the 72 vaccines that are essentially mandated to children. If children receive all the vaccines in the student immunization program, they will get almost 13,000 micrograms of aluminum and almost 600 micrograms of mercury, as well as 200 other chemicals. There is substantial scientific evidence proving the association between neurotoxins, mercury and aluminum, and autism spectrum disorder. According to the 2019 Canadian Government Health Survey, 1 in 50 children and youth between the ages of 1 to 17 years were diagnosed with autism spectrum disorder, an increase of over 500% since 1990. The Board of Health is accountable to the citizens of Toronto. The members of the board need to take action to protect the people they serve in this city from the actions and directives of the pharmaceutical industry and other entities and organizations.
Okay, final thoughts?
Final thoughts is that doctors are being disciplined and fired for signing exemptions for vaccines. And we heard at the last Board of Health meeting that even city councillors are being discouraged and prevented from signing non-medical exemptions.
Thank you, you're at time.
You
Any
shouldn't need an
questions?
exemption to opt out of
You
a
are at
medical
time.
procedure.
Any questions for the deputant? Seeing none, thank you. Okay, we'll now take it to directors. Any questions for staff on this item? Councillor Thompson.
Thank you, and thank you, Dr. Lampney, and congratulations with respect to the assumption of the leadership for a brief period of time. Nonetheless, your expertise, we will rely on that. I just wanted to ask you around the, the harm reduction or safe injection sites, what are some of the public complaints and some of the issues as to the problems that members of the broader community have with respect to these locations?
To the chair, I'll start, and then I'll perhaps include some respondents from our wider team. If I understand the question correctly, you're asking about what are...
Me to restate it?
Yes, please.
Okay. What are the problems associated with the harm reduction facilities that people are complaining about?
So again, to the chair, our understanding is that in some neighborhoods, there are residents near safe consumption sites who are concerned about visible items in public places associated with substance use. Also concerned about people congregating to use substances, and we encourage people not to use alone because that is a risk factor for fatal overdoses. And also concern because people might choose to congregate together, just crowding around public entryways. Those are some of the concerns that have been expressed by members of the public. And those are some of the reasons why there are tight regulations around the operations of supervised consumption facilities put in place by the provincial government. I see some nods from my colleagues. I'll just ask our Director of Clinical Services if there's anything she would like to add.
Thank you, through the chair. I think, Dr. Lamptey, you did cover a lot of what we hear. And as Dr. Lamptey shared, we do have a process in place where the sites are regularly reviewed and inspected to ensure that they're following the compliance standards. I'm going to pass it over to our Associate Medical Officer of Health as she has some thoughts as well.
Thank you, through the chair. In addition to what Dr. Lamptey and my colleague Sana have stated, is that through this process where we do receive complaints from the community, I do want to stress that many of them actually don't meet the criteria under sort of our regulatory purview. So as Dr. Lamptey had mentioned, things like loitering or gathering in front of the site, there's not much public health can do. We enforce more of an infection prevention control standard. So I haven't looked at the latest data, but at one point, for example, we had received over 100 complaints, and I think only 1 or 2 of those complaints had actually met the criteria for which we can actually, support.
So there is a criteria that exists for public health in terms of dealing with these issues, but there are broader concerns that the community has. So is there a mitigation plan for safety, for example, concerns that the public has, as well as you mentioned about loitering and so on? While it may not be the issue for public health, whose responsibility is that? Because the issue that we're dealing with here is that large groups of members of the public are not in support of these facilities because of some of the things that's been described, yet we rely on public health to ensure that the injection facilities are in place. The province is reacting to the public complaints, and we don't have a mechanism to deal with it from a city perspective. So should there not be a plan? And if not, can we have a plan, even though we want to ensure that these facilities are open for the importance of the people who came in to speak about people who are dying? So there needs to be a plan, and it doesn't appear to be that there is a mitigation plan. So what's the plan?
To the chair, I think there are two components to your question. So certainly, each supervised consumption site is expected to have its own safety plan, as well as tables or meetings with members of the public surrounding their site. That's part of their operational obligations. Of course, Toronto Public Health has that for its own site, the works, including a security plan and regular meetings with many constituents, including neighborhood businesses and other institutions in the area. In terms of the coordination of all of the heart hubs, that actually falls as a clinical service under the purview of Ontario Health. Ontario Health is responsible for coordinating clinical services, whether it's hospital services, paramedics, community care. So they really have the responsibility for coordination of clinical sites.
Thank you. We're at time. Any further questions? Councillor Chang, go ahead, 5 minutes.
Thank you. Through the chair, I'm just wondering, as the heart hubs are going to be implemented and the province would have purview of the clinical services and the operators would then have the safety plans in place. But what is the role of Toronto Public Health, especially when it sounds, from the public outcry that has resulted in this provincial direction, that people have not felt heard, that perhaps there have been worries that have not been addressed in a meaningful way?
To the chair, I can begin. So first, I think if you look at the essential functions of public health, one of the key roles we have played and will continue to play is to provide the epidemiology and surveillance data that lets us diagnose the severity of the issue and how the trends are changing. So you'll see a lot of the information sources around the impacts of the drug toxicity epidemic are conveyed through regular publications and releases from Toronto Public Health. So we'll continue to play that role and share it with.
But sorry, because I want to keep to time, with regard to safety, because I think that's been what people have been talking about, safety, drug paraphernalia in nearby playgrounds, these issues. Are we tracking data on those pieces or only on the health-specific data?
To the chair,
Sorry, Dr. Lamptey. Just want to remind my colleagues that we're speaking to item 4, right? Not item 6. I know it's related.
It is a report.
It is a report, yes.
A year-end report. So we can actually expand our reach into this issue.
Yeah.
So there's nothing wrong with that, Mr.
I'm not saying there's nothing
With
wrong.
great
I'm just
respect.
reminding you that we can
clear.
also speak to it. Fair enough. Thank you. Continue, Councillor Chang. Go ahead.
Sorry, I finished my question.
Yeah, Dr. Lamptey, go ahead.
So to the chair, I think your question is around what is the role of Toronto Public Health and overall safety? I don't think we have a direct role, but we do have, of course, ongoing conversations with our colleagues in other divisions like Toronto Police Services, as well as waste management.
So when we have a safe injection site and for good purposes, as we heard from many deputants, we don't actually track the data on the impact. That is a responsibility of the police, or who would be overseeing the integration of these services to ensure a positive outcome for everyone?
To the chair, so if you're talking about supervised consumption services and heart hubs, they are funded and mandated by the provincial government. So in terms of the implementation of the rollout of the change, that's a provincial responsibility, including many parts of the Ministry of Health, such as the branch that involves mental health and addictions.
Okay, so we're going to hope that the province has a plan in the implementation of the new model, but even still, there will still be some safe injection sites that will continue, and the overall community impact from a higher level to oversee that, to ensure positive outcome for everyone, that is the responsibility of the province. Is that what I'm hearing?
To the chair, yes.
Great. My other question is regarding the fifth priority about nurturing a positive workplace. And I know that a lot of Toronto Public Health did a lot of heavy lifting through the pandemic, and maybe there was some burnout from that, and there's some turnover. People are kind of needing to transition. And I'm just wondering, what can we learn? Is there anyone who's done an analysis of the employment learnings that we've had from combating a huge pandemic that can be applied if something else happens? What can we do to mitigate that impact on the workforce?
To the chair, actually, there have been many analyses that we've done across our teams on many aspects of our COVID response, including hearing from employees and noting the opportunities for improvement. And in fact, some of the lessons from those conversations and evaluations informed, for example, the way we responded to the respiratory season 2023 to 2024, and this year 2024 to 2025, in terms of being able to respond to surges in a way that also incorporates thinking about staff resilience and energy levels. So yes, as a whole organization, we're looking at this, and TPH People Services has a long list of initiatives to address what we learned from our pandemic response.
Great, thank you. Those are my questions.
Thank you. Any other questions? Go ahead, Director Ozude.
Thank you so much for the presentation. I noticed here that it says that there was a launching of online vaping prevention resources. I remember at I believe it was the CEO Health Check presentation, there was some figure shared that vaping had gone down slightly amongst youth. Any updates on that, on vaping?
To the chair, I don't have any updates right at my fingertips. I'll just ask my colleague, our Acting Director of Community Health and Wellbeing, if there's any updates on youth vaping.
Hi, thank you. Thank you for the question. We were very excited to launch our vaping resource hub in September of last year. So it's only been a few months, but we've seen close to 10,000 people access the resources online. We've been working closely with our school partners in terms of the uptake of the resources, working with administrations and teachers to get the information out. And we continue to monitor the data, and hopefully we can report back on the outcomes of that.
Thank you.
Okay. Any further questions from anyone? I do have a few, and I'm going to front load them just so I could get them all in. So you mentioned 277 Victoria Street, and you're in the process of staff moving out of there. Are you on track for the move? Perhaps touch on retention in the department as to where we're at. Also, during the budget process, I did ask many divisions about what role they will play when it comes to the closure of supervised consumption sites. Some do have some robust plans, others have none, and they redirected me back to public health. I see Gord Tanner's here is one of the few people who actually gave me a substantive response when I asked that question. Also, too, the last week or so, we heard of 2 owls dying at Tommy Thompson Park, I think as a result of bird flu. Are there any other emerging diseases or pandemics globally or, locally that we should be aware of? Those are my questions.
Thank you, Mr. Chair. I'll try and remember all the content. Maybe I'll go in reverse order. So in terms of avian influenza, that is something we have been assessing and preparing for quite some time in consultation with our provincial partners, because response to it involves, as you noted, surveillance on animal health and the ability to be ready to respond if there, is a human case. I would say that is the main emerging infection that is taking most of our time in terms of concern about potential severity if the virus evolves to be able to transmit efficiently between humans. If Dr. Finkelstein has any other emerging infections he'd like to add.
Thank you to the chair. I think there are 2 other issues which we are focused on. One is, in fact, the reemergence of diseases which are vaccine preventable that we are continuing to track and respond to. The pandemic has impacted the uptake of vaccines, and our vaccine preventable disease program is responding to that, but we are tracking diseases which, like measles, which are in our environment and which are been reduced by vaccines because they may reemerge. And the other thing is we know that there's an outbreak of Mpox, which continues in other parts of the world, and we are watching very closely to see if that emerges here, and are also working with our colleagues in the province to be ready for it. Thank you.
Okay, thank you. And I think that your third question was about
safe consumption sites and our preparedness and working with other city divisions to probably help mitigate the impacts of that.
Okay, thank you, Mr. Chair. So, of course, Toronto Public Health's work is first to make sure that our own clinical services have a plan to be able to continue their operations after April 1st, as allowed by the Community Care and Recovery Act. And some of that includes working with other partner divisions, because some of our services are actually delivered in the sites of other divisions, like the Toronto Shelter and Support Services Division. So, of course, those conversations have been some of the closest ones. In addition, because the transition necessarily involves partnerships with other clinical agencies, those discussions have been ongoing so that we can begin operations as soon as we get more details from the provincial government around funding. In addition, I would say that...
But I also want you to also comment on coordinating with other city divisions, though, not only external divisions, external bodies, but within the city itself.
Right. So I think some of the opportunities for that will occur as the social services cluster meets. Some of the probably most affected divisions would be Social Development and Finance Administration, TSSS, and Toronto Paramedic Services. So that will continue. I will say that right now the intense respiratory season, I think, is top of mind for many of our responding divisions, and as that proceeds, attention will shift in addition to planning for the changes in April.
And my first question was around 277 and the move, and also to staffing retention.
So I'm pleased to say that Mr. Chair, I'm pleased to say that the very concerted, diligent planning efforts of many people in our operations business services has meant that our move is on track. Although any kind of change can be stressful, we did plan to make sure that employees knew what was going to be involved and that there were resources for them when they move locations. In terms of retention, I'm perhaps going to ask our Director of Operations Business Services, Myron, to make any statements around that. From what I can recall grossly, our exit rate is not substantially higher than previous year. But Myron, would you like to add anything further?
Thank you. And to the chair, as you may be aware, there are multiple programs that are in place within our division to ensure that staff feel adequately trained, are appreciated, and want to continue their career within TPH. So we're continuing working on those programs and enhancing those as well.
Thank you very much. Much appreciated. Seeing no further questions, any speakers on this item? Councillor Thompson.
Thank you very much, Mr. Chair, and through you to staff. I want to thank the staff for obviously an excellent presentation with respect to a year in the review. But it's really important for us to understand. I just want to focus specifically on the, consumption sites and harm reduction focus. We've heard time and time again the complaints from the public as to the challenges that they're having within their respective areas where these facilities are in place. And these facilities are extremely important because they are there to help those who are in need and to save lives. And that is something that's a priority for us. I mean, safety is always a priority and everyone's life is important. But it appears that we tend not to listen. And I don't think it's the fault of public health. It's a collaboration opportunity that we have missed. And why is the province involved? Because they're getting a lot of complaints from the public about the fact that the city isn't doing its share and taking on the appropriate responsibility to ensure that they themselves in neighborhoods feel safe. Now, this doesn't fall simply on public health and as a primary issue. It is a collaborative approach. I know that it's been mentioned in terms of varying department FCFA and tests and so on and so forth. But I think, Mr. Chair, perhaps this is an opportunity for you and the Vice Chair to fully engage with respect to collaboration with staff in order to ensure that the political lens is put on this prior to it coming in a report so that there could be further discussions and the public's concern can be taken into strong consideration. Not to suggest that staff wouldn't take it into consideration. It is just that the way it's purported to us as political leaders is perhaps quite different in terms of the expression by the public and how we perceive it. It may be different from what staff may view this particular concerns from the public. I think more needs to be done. A mitigation public safety plan has to be in place. I have in my ward a number of issues and concerns that have come up, which I won't get too involved in at this point in terms of expressing concerns that I have, but broader concerns from members of the community. We have facilities in the community where we have put people in my area that are specifically suffering from specific conditions, severe conditions, and they're all in the same place. There is a dependency with respect to need for drugs and so on to maintain, I guess, the viability of these individuals. But it has tremendous impact on the community. And the community concerns, and it's brought out, it appears that there is a disregard of interest by those who are in position to make decisions. I'm not saying it is, but that's the perception that the public has. And those are concerns that are extremely important. People are also concerned about their safety and the impact that some of these facilities and individuals using these facilities pose to the community. And that's the reason why we have this outcry. That's the reason why people are going to the province to say, province, you do something about it. That's the reason why the province is responding. So I know we talk about the province here, and there's a perception that they are the bad people, quite frankly. What are they doing? They're responding to complaints that we appear not to be addressing as a city. And I think that we've failed the public in that perspective. And I think there's more that can be done and should be done. I don't think it's a question of just simply moving a motion that suggests more collaboration takes place. I think it's really common sense to recognize that if you put one of these facilities in a specific area, there are huge challenges that arises from it. If you don't think about it in advance, obviously we get the effects that we're actually having now in varying communities across the city and the complaints that come forward. And so now we're dealing with this. We have to look at potentially intervening in court actions and spending lots of resources to address those issues. Whereas perhaps had we have approached it differently, we would have had different outcome. So because we've taken the positions, because we have not looked at it in a sort of collaborative way, we are where we are. And so I thank the staff for everything that's been presented, but this is a huge issue overall in the city, and that's part of the reason why we're having these challenges. We need to fix it.
Okay. Thank you, Councilor Thompson. Any further speakers on this item? Okay, I will speak. So I too want to thank staff for all the work that they do and continue to do. I know 2024 was a challenging year for all of us, especially for you. There's a lot on the plate of public health. There's been a lot of changes, as Dr. Lamptey mentioned, Dr. Davila's departure, moving from 277 Victoria Street, which is a home we've known for decades, I'm gonna say. And change is hard, but they always say that one constant in life is change, and change continues. I heard what Councilor Thompson said. I don't disagree with him, but I do want to say, though, that we know that mental health is health care. Addiction is health care. There seems, when the province doesn't come to a table in a way that is in partnership, it falls on the city to actually pick up the slack. We see that when it comes to even encampments in our city right now. A lot of the people that are in camps and also in our shelters, I think I heard 53% of people in our shelters are refugees. That's because the feds didn't come to the table in a substantive way. And as a result, the lowest hanging fruit is the city. And we're always having to pick up the slack every step of the way. I've had health care summits with my federal and provincial counterparts talking about these issues. The mayor has had meetings with her counterparts about this issue. This is ongoing discussion we've had. As recently as Friday, we had a meeting with various healthcare leaders across the city talking about some of the challenges they're facing, including what will happen in our emergency departments when safe consumptions close, right? I mean, everyone is concerned and the system is becoming overwhelmed. Our staff is overwhelmed. I'm overwhelmed, if I'm being totally honest. So we are doing all we can with the resources that we have, with the limited resources that we have. And so I think we need to continue working with and trying to bring the province to the table. Even in the deputations we've had today, and in our special meetings we had before Christmas. Deputants came here to tell us how they felt about safe consumption sites because the province decided that they were not going to have any public meetings on that. So it's not a lack of trying on our parts. We're doing all we can. And I don't blame Torontonians and people across this province for being frustrated. They are frustrated, and they have the right to be frustrated. And I hope as this next provincial election approaches that people take a, look as to what it is they want from their provincial government and vote accordingly. Anyways, and I'm sure we'll continue to have conversations about this throughout the year and years ahead. But we, as a Board of Health, will continue to look after the best interests of our city and the people that live within it, because we are a caring and loving city, and we embrace everyone, no matter where they are on the spectrum in regards to wealth or poverty and everything else in between. Those are my comments. Seeing no other speakers, I'm going to move a motion to adopt staff's recommendation on this item. All those in favor? Opposed? Is the to receive. There's no recommendation. My apologies. To receive this report. All those in favor? Opposed? Carried. The next item is HL 21.5, feedback from Toronto Public Health and Homelessness Working Table. There is a presentation on this item. Dr. Lamptey, you want to introduce the speakers?
Yes, Mr. Chair, I'm delighted to welcome our Acting Director of Strategy, Vanessa Fletcher, and Dr. Lori Ross from the Dalla Lana School of Public Health, who will speak about the Health and Homelessness Working Table.
Good morning. Can you hear me? Am I on the mic? Good morning. Can you hear me now?
Is the red button on?
The red light is on.
There we go. I can hear you now.
Good morning. I'm pleased to join you today to share the discussions from the Health and Homelessness Working Table. I'm joined by Dr. Lori Ross from the Dalla Lana School of Public Health, who was a member of the table and who will be sharing some of their discussion points later in the presentation. Before we get started, I wanted to express gratitude to the members of the working table for their dedication and insights, and to the Board of Health for its ongoing commitment to addressing homelessness as a public health priority. Next slide, please. For today's presentation, first we'll be going over the background of the Health and Homelessness Working Table and their meetings. From there, we'll provide an overview of the City of Toronto's work to address homelessness, followed by Toronto Public Health's role in this space. We'll then share the feedback gathered through the working table, highlight key recommendations, and conclude with the proposed next steps. Next slide, please. In January 2023, the Board of Health initiated a review of the intersection between health and homelessness, recognizing the urgent need to address this critical issue. The Health and Homelessness Working Table, including experts and individuals with lived experiences, convened 8 meetings to provide recommendations aimed at improving the health and well-being of individuals experiencing homelessness in Toronto. The working table met between August 2023 and May 2024. They focused on critical areas including healthy environments, chronic disease management, the needs of refugees and asylum claimants, safety and injury prevention, mental health and substance use, and health across the lifespan. The overarching recommendation from the table was to establish a collaborative group that would be led by the federal and provincial governments that would address the needs of individuals experiencing homelessness. This group would integrate the feedback provided by the working table and prioritize a health equity approach in its efforts. Next slide, please. Throughout the working table meetings and in the writing of the final report, we collaborated with colleagues from Children's Services, Senior Services and Long-Term Care, Social Development, Finance and Administration, Toronto Shelter and Support Services, and the Housing Secretariat. It's important to note the many initiatives throughout the City of Toronto that are addressing the health of those experiencing homelessness already. These include the Housing TO 2020-2030 Action Plan, embedded health programs in our shelters, the Interdivisional Protocol for Encampments, the Homelessness Services Capital Infrastructure Strategy, and ongoing advocacy for expanded and sustained funding from the provincial and federal governments. Next slide, please. We also have several programs and initiatives at Toronto Public Health that help support the health of those experiencing homelessness. Toronto Public Health recognizes housing as a key social determinant of health and actively advocates for sustainable, affordable, and appropriate housing. Toronto Public Health also provides a range of programs to support individuals experiencing homelessness, including dental clinics, prenatal and parenting programs, immunizations, and harm reduction programs, some of which are embedded in the city-run shelters. We track and report data related to homelessness, providing critical insights to inform policy and programming. This includes biannual reporting on the deaths of individuals experiencing homelessness, and there's going to be an updated dashboard going live later this month. Through these efforts, Toronto Public Health remains committed to addressing homelessness. I will now pass it along to Dr. Laurie Ross. Thank you.
Thank you, Vanessa. It's a privilege to speak to you today as a member of the Health and Homelessness Working Table. I want to acknowledge my fellow table members whose names are provided in the summary report. There is an incredible wealth of expertise around the table, and in the time we have today, I can only provide you with a tiny snippet of our conversations. Next slide, please. On the screen here, you're seeing the framework that guided our discussions, which was proposed by one of our table members, B. So. This framework helped us to keep front of mind that in order to address the health impacts of homelessness, we need to be working at multiple levels. Before I move into sharing some of the specifics of our discussions, I want to emphasize two key points that we revisited across all of our meetings. First, the foundational cause of the health impacts of homelessness is the lack of safe and affordable housing in the city, alongside the social and political conditions that have produced and continue to reproduce this situation. Downstream interventions to address the specific health impacts of homelessness, while essential, are wholly inadequate on their own. We must also address these foundational causes. Second, we acknowledge that homelessness and its impacts are inequitably distributed and that they disproportionately impact Black, Indigenous, and people of color, refugees and asylum claimants, 2S LGBTQ+ people, and people with disabilities, amongst others. Any interventions to address homelessness and its health impacts will need to be taken up through an anti-oppression lens to ensure that the interventions do not further widen existing inequities. Next slide, please. Moving on to some of the specifics of our discussions. As was shared, the Health and Homelessness Working Table discussed an array of topics spanned over 8 meetings. And on the following 3 slides, I'll share a very brief overview of some of these discussions. Starting with healthy environments, it's clear that environmental conditions like air quality and extreme weather significantly affect health. People experiencing homelessness are at higher risk of hypothermia, heat stroke, and worsened health conditions due to limited protection from the elements. Our working table emphasized the importance of coordinated efforts during extreme weather events with clear and accessible communication to ensure that individuals know where to access support. Free public transportation access to warming centers and cooling spaces was identified as a critical gap that needs to be addressed. Another area that was often highlighted in our discussions was service delivery, communication, and accessibility. These discussions highlighted the need for walk-in availability and mobile services, as well as integration of multiple services within a single location for ease of access. Embedded services in city-run shelters were seen as highly beneficial in reaching individuals where they are. We emphasize that trauma-informed approaches are vital to creating safe and supportive environments for people accessing services. Peer-based programs like St. Michael's Navigator Program were noted for their value in building trust and engagement. And finally, continuity of care is crucial when individuals transition from homelessness to housing in order to ensure long-term stability and good health outcomes. Next slide, please. The working table highlighted that a lack of collaboration across sectors such as healthcare, social services, housing, the justice system, and community organizations can create significant gaps in addressing the health needs of individuals experiencing homelessness. Coordinated efforts are essential to ensure more consistent support, particularly during transitions between services. Increased collaboration can also help to reduce duplication of services, minimize care gaps, and ultimately lower reliance on emergency room services. We had specific discussion focused on refugee and asylum claimants experiencing homelessness. Precarious living situations were identified as having profound negative impacts on physical, mental health, as well as overall well-being of these members of our city. The working table called for the development of a targeted health action plan specifically focused on refugee and asylum claimants experiencing homelessness. Such a plan would address their unique health needs, including access to culturally appropriate and trauma-informed care. Coordinated care environments, or hubs, were identified as a promising approach to help refugee and asylum claimants navigate transitions and find greater stability in the city. Next slide, please. The working table highlighted that mental health and substance use challenges are deeply interconnected with and often exacerbated by experiences of homelessness. We emphasize the need for a provincial review of mental health and substance use services to assess their overall effectiveness, accessibility, and identify key gaps in care. Relevant to other conversation at this meeting today, there was a clear call amongst our working table members for increased funding to expand supervised consumption sites and detox facilities. Our discussion stressed the importance of maintaining a harm reduction approach while also ensuring strong connections to recovery programs for those who wish to access them. Finally, in our discussions about health across the lifespan, we underlined that individuals experiencing homelessness require tailored supports based on their stage of life. For pregnant individuals, there's an urgent need to improve access to prenatal and postnatal care. Discussions around children and youth highlighted the importance of stability, educational support, and access to non-clinical interventions to improve health and well-being outcomes. For seniors and older adults, we emphasize the need to address barriers to geriatric care and long-term care services. Across all age groups, there was a call for increased access to supportive and appropriate palliative care services when needed. And finally, across all these life stages, the working table emphasized the importance of increasing social assistance rates and creating more coordinated care environments to ensure that people experiencing homelessness can access the necessary health and social services when and where they need them. And with that, I will turn things back over to Vanessa.
Thank you. Next slide, please. Thank you, Dr. Ross, for sharing those findings and recommendations from the table. For next steps, there's quite a few recommendations in the report, but I'm going to focus on what Toronto Public Health is committed to doing within our own sphere of influence, and to address the health of those experiencing homelessness through the following: reviewing Toronto Public Health services to assess accessibility, walk-in availability, and need; addressing Toronto Public Health services, assessing Toronto Public Health services and implementing training and resources to ensure a trauma-informed approach across the organization as directed in Toronto Public Health's strategic plan; connecting and collaborating with other city divisions and healthcare partners to share and support the implementation of the other recommendations shared by the Health and Homelessness Working Table. Through this, we will continue to expand our impact and work toward achieving the complex health and social needs of people experiencing homelessness in Toronto. Thank you.
Thank you. Councillor Bravo.
Thank you, Mr. Chair. Thank you for the report. It was great to see the robust participation, and I guess my questions are focused around the particular population that's been identified as in need of support. Did the did the table deliberate beyond refugee claimants and asylum seekers on people without status? I point out the fact that once your refugee claim has been accepted, you have status or you're in a different situation. And this board has long had a policy around undocumented people, undocumented workers.
Thank you for the question. The working tables conversation did choose as a particular focus to speak to the concerns of refugee and asylum claimants, particularly because at the moment that the table was coming together, there was a lot of concern about inadequate housing for refugee and asylum claimants in the city, and the concerns around the federal government's responsibilities related to that and how that was being negotiated between federal government and municipal government. Having said that, I think many of the interventions that we're proposing are also certainly relevant to individuals who are undocumented. And so I would hope that as these recommendations are taken up, that they would also consider the specific concerns of undocumented individuals as well.
Thanks. In terms of the, because of our obligations, because we have a policy here, around, it's called Access TO now, but it's really the Access to City Services for Undocumented Torontonians. Do you agree that it's important to hold that tension, and that's, it's very likely that, or there's a good possibility that a person who's presently seeking asylum could end up undocumented in the longer term?
Absolutely, I agree with that.
And in terms of the, thank you for pointing to the federal government's responsibility and obviously the provincial government's responsibility too. In the call for a health action plan that includes a trauma-informed approach for refugee claimants and asylum seekers, and the whole range of, you know, you can be a sponsored refugee, you have your claim is recognized, you make a claim at the airport, or you register it. Once once it's certified, then you get a certain status. You can make an inland claim. There's all kinds of different pieces here, but we're singling here that this is a federal and provincial government responsibility. Is that correct?
So we're, as a working table, we're signaling that addressing the impacts of homelessness, including for refugee and asylum claimant seekers, will require cooperation across all three levels of government, given that there are important responsibilities within the jurisdiction of all three. Does that address your?
Yeah, I mean, thank you. It's just because it's wanted to make clear that it's not a responsibility for Toronto Public Health or a municipal order of government to develop a specific plan for refugee claimants, refugees, asylum seekers, and I just wanted to highlight that.
Certainly, and I think what the working table is suggesting is that we would like to see within the services that are provided by Toronto Public Health, attention specifically to the considerations of these
Thank you.
Thank you. Any further questions? Councillor Thompson?
Thank you very much, through Mr. Chair, and thank you so much for your presentation. I did get the latter portion of it in my office because I was at a meeting and the TVs are on in there. I just wanted to ask specifically around the refugee piece, and I know some questions have been asked already, and I understand the substance of your report. That wasn't necessarily the focus, but it's not absent of that either. We had a situation a couple of years ago at 129 Peter Street. The refugees that came in from Africa, and they were basically on the road or on the sidewalk for many, 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 many days. Subsequent to that, there was a report that was produced by the Ombudsman of the City of Toronto. It was submitted through the process to City Council. The city manager decided not to take any actions, not to address any of the recommendation. In fact, the very first time in the history of the City of Toronto, any of the accountability officers that report through council, that their recommendations were not taken into consideration and or were not really addressed at all. I'm wondering, with respect to your report, did you take a look at the issues affecting those individuals? Did you take a look at the report that was produced by the Ombudsman? And did you take a look at the recommendations and whether or not that would be, instructive as part of your recommendations here? Not to fight with the federal government, not to say these are your responsibility, not to say that the city can't afford it, but you have people who were basically left to suffer the elements, and we're all passing the buck. So I'm just wondering, did that report form any sort of input, both in terms of the Ombudsman report itself or the specific unique situation that occurred in our city during that period of time?
I can say that the working table did certainly consider the particular issues around refugee assignment claimants lacking access to housing within the city. I honestly don't recall whether that specific report was part of the materials that the working table was given to consider in the specific meeting where we discussed issues particular to refugee and assignment claimants.
I'm happy to jump in there too. So Toronto Public Health worked with SDFNA and the Access TO newcomer office in the development of the presentation that was brought forward to the working table. And that didn't form the basis of the presentation. So maybe that's something that
I'm sorry, that did inform or didn't?
Not. And I'm wondering about, yeah, I think I'll leave it there then.
So through you, Mr. Chair, do you not think that would be helpful and instrumental and be effective as part of the consideration? Now, you say that didn't form it. Was that because you didn't think about it? Just because it wasn't important? Just because it wasn't something that came to mind? I mean, what was the rationale? Because that was such an important matter that affected the city, although we have basically drastically abrogated our responsibility in terms of dealing with these people. I'm just curious that this is such an important thing and you had such an example. Would that not have formed part of your sort of analysis to help us to be more informed as to federal government, you need to do more, city, you need to do more, provincial government, you need to do more, we all need to do more? I'm just wondering, why is that absent?
I don't think I can answer why it was absent, but we do rely on our colleagues to help us inform the conversations. So, we take that as feedback, and thank you, Councillor.
So, just my final question then. So you rely on your colleagues. So would that have been city agency, SDFA, and others to help you to formulate or some of the issues that are affecting the city and its challenge and the complexity in terms of dealing with these issues? So that did not sort of germinate and rise to your level as part of input from city departments?
That's right. So each time that the working table met, we covered different topics. So based on the topics, we would invite the experts to help us inform the conversation.
Thank you. Thank you, Mr. Chair.
Yeah. And just to follow up, I think the table met 4 times last year?
They met 8 times in total.
8 times, okay. Thank you. I see that Director Ozade has a question. Go ahead.
Thank you so much for your work behind this. Yeah, this is a really cool report and the findings. I guess we're all synchronized on the board with regards to the refugee and asylum claimants, so that's what one of my questions would be on. I see for the second point on refugees and asylum claimants, it calls for a targeted health action plan. What would this look like? Because in my own words, just like Councillor Thompson was saying, we had a situation 2 years ago where we had a lot of these refugees and asylum claimants, and a church and a restaurant had to be converted to a shelter. I ended up speaking with some folks at the city, and they said things were done about that. So I'm just really curious on what a health action plan would look like.
Thank you for your question. I will say that while I fully agree. The issues specific to refugee and asylum claimants are a very significant part of this issue. It actually formed the basis of one of the 8 meetings. So within that one meeting, we didn't have time to, in a fulsome way, discuss what specifically we would like that health action plan to look like. I think that our hope is that this recommendation would be taken up by Toronto Public Health in collaboration with other relevant partners, including community organizations, in order to develop the specifics of what the plan would look like.
Okay.
Thanks, Dr. Ross. I'll also add that the recommendation before you, number 2B, really directs Toronto Public Health to work with other city divisions to implement the recommendations of the working table. So if you can imagine that the working table has met 8 times, and this is the first time the report is being presented and being shared publicly, now it's time after this to get to work to see how we can implement those recommendations.
Okay. Thank you so much. And I have one more follow-up question. So I think we all accept that homelessness is one of those issues that cuts across different sectors, different socioeconomic status. We may all have an idea of what a homeless person looks like, but in reality, that's not the case. So for the lack of collaboration across sectors, I'm curious, did you find in your report or in your conversations why there's such a lack of collaboration or disjointed efforts in addressing this really important issue?
Thank you for your question. I think one of the main issues that we felt was contributing to that lack of collaboration is simply that many of these services are under-resourced. And so they have inadequate resources to maintain the level of coordination and collaboration that they would like to have. I would say that based on the experiences and perspectives of the members of the working table, it was really more an issue of inadequate resourcing rather than any kind of lack of will or investment in making sure that these folks' needs were appropriately met.
Okay, thank you. One final question. I noticed you referenced St. Michael's Hospital peer navigation program. Is there peer navigation for people who are living incarceration or just people who are unhoused?
I believe that program is for people who are unhoused.
Okay. I know that people who are living incarceration tend to be at higher risk of homelessness, and I think the pandemic really exacerbated a lot of that. Was there something that you found in your conversations on how to improve housing or reduce homelessness for this vulnerable population?
I'm sorry, can you repeat the population?
So people who were previously incarcerated.
Okay.
Yeah.
Yes, thank you. There was some discussion about that issue, and that came up around thinking about coordination with justice systems and making sure that there would be coordination for individuals at the time of leaving incarceration to consider what kinds of housing options needed to be provided. Again, it's an issue that we didn't go into a lot of depth about, but certainly that population was one that was recognized as having particular considerations.
Okay, thank you.
Thank you. Councilor Bravo? Oh, yeah, you did. Any further questions? Councilor Chang, go ahead.
Thank you. Through the chair, on page 5, there's mention of funding for low barrier crisis stabilization spaces. And I'm just wondering, has the city put in a business case for such a stabilization center, including the impact on financial savings it could garner in our healthcare system?
I'm wondering if we could defer that question until questions of staff, because there's colleagues here of mine that would be better positioned to answer that.
Right. We're asking questions of the deputants right now. Sorry about that. I missed that. I will wait.
Well,
I'm sorry?
they are staff, so you could.
Right.
You could ask questions of staff right now if you'd like. Oh, we don't have the right people here to answer those questions. I'm sorry.
Okay. I will move on and circle back offline with that question.
Okay.
So we can ask any question about this report now, or is it specifically to the presenters?
On the report, and they could redirect it to staff if they like.
Great. Okay. So this is also about the public bathroom access that was raised on page 7. And I'm not sure if anyone in the room knows where the city is at in our bathroom winterization, which launched a couple of years ago. And have we also done any advocacy, perhaps with Metrolinx, on including bathrooms in all new future Metro subway stations, because those are really critical points of access that could provide.
I think that's an ECDC question, Councillor Chang.
Okay. Okay.
Yeah.
And then I will go to my third question then.
Okay, good.
With regard to service hubs for refugees, is this a suggestion of establishing these service hubs different from the request that we've made to the federal government to create a welcome center near the airport to support those who are claiming asylum status, versus is this suggestion to create service hubs specific to asylum seekers that are already in Toronto?
I think that the recommendation, as I understand it, would be distinct from that, in that we're looking at, for individuals who are already in the city, how can we provide a hub of resources and supports that will address their health and also other needs related to social determinants of health, including housing.
Thank you. And is there anyone in the room who can speak to whether or not something to this effect is being actioned currently in the city?
I don't think there's anyone in the room right now, but it's just a reminder that the recommendations from the Health and Homelessness Working Table, they're new. They were just released with this agenda. And so one of the recommendations before you is for Toronto Public Health to work with the other city divisions on implementing them as appropriate. So there's opportunities to action those recommendations in the future as is next steps.
Yeah, and I think it'd be appropriate to speak to parks and recreation on some of these items because they're responsible for those things, right? I mean, public health make recommendations and it's up to city divisions to actually implement them if they can. Okay?
And so would we be tracking that then on the other side, now that this report is out, that in the coming months we would track how divisions are responding to these recommendations?
Well, we can ask for it to come back, or we could definitely get a follow-up. I think they do usually annual reports on these things, so it may come back eventually. But if you track it, you'll see it at various committees in the city, because there is direction here. For example, recommendation number 4 talks around TSSS, collaborating with various departments. Okay.
Great, thank you. Those are my questions.
Thank you. I do have one question, and it was alluded to. So again, we're talking about homelessness, you know, and people's health and how to work with other levels of government. But one of the things that I haven't really seen here is that when it comes to people who have been incarcerated, especially young Black men or Indigenous men, they may have, let's say, a possession charge when they were younger, and that they now have a criminal record for the rest of their lives. And even though the laws have changed over the years, that still remains on their record. And for example, if someone has a criminal record, they can't work for the city, they can't work for the province or the feds. There's certain opportunities that they just don't have access to. So I'm just wondering, and again, these are great recommendations among all the things we do here in this on this board. But at what point are we going to perhaps ask the federal and provincial governments to clear people's records, to actually help people not be homeless? Because all these things in place prevent people from actually having, a decent way of life. Any thoughts on that?
Thank you for that important point. I don't recall that specific issue in terms of expunging records came up as part of the Health and Homelessness Working Table meetings, but apologies. I don't recall that specific issue around expunging records came up in our discussions around the working table meetings, but I would agree that it fits squarely within our recommendation that an anti-oppressive lens needs to be taken up when implementing all of these recommendations, and that concern would certainly fall within that and be very much worthy of attention.
Mm-hmm. And now that it's on my mind, I'm thinking maybe I should bring a motion forth to actually add that. And I see my staff's in the room. Can you put something together quickly? Thank you. I will hold this item down because I do want to add that recommendation. Sorry, any other questions of staff on this?
Can individuals petition to have the records expunged? The law already allows it.
Well, people can do that individually, but I think there needs to be a systemic approach to doing that. Again, to navigate the court system and the justice system is difficult. You need to have resources. In some cases, you need to have an address. You need to have ID. You need to have all these things. And the onus is on the individual when really it should not be. And it's an equity issue as well.
So what would you be asking for? That, after 6 months, your record would just be...
Well, I'm asking that, for example, possession of cannabis is no longer an issue. It's no longer criminal, I'm saying, to use cannabis. But yet, for people pre this time,
they have a record for possessing cannabis.
They do, and I think that's inappropriate, among other things.
So those records should be expunged. Anything that's become legal, if you committed a crime on...
I mean, for me, it should go further than that, but to start with, I think that's a good start. I see Councilor Bravo has a quick, yeah, I think so. I mean, again, I would like to go even further than just cannabis, but maybe broadly speaking. I'm giving direction to staff as I say this now. So seeing no other speakers on the item, I'm going to hold it down as we work on this one motion. Okay? Okay. Can I hold it down until my motion's ready? Okay, thank you. So we'll move then to item 7. I know the agenda is all over the place today, and my apologies. So item 7. Yes. Enhancing food and safety at special events. Councilor Thompson has questions of staff.
Yeah, through you, Mr. Chair. I just wanted to sort of get a better sense of understanding as to what are the matrix that we're going to be using in terms of the tools with respect to compliance and looking at sort of the reduction of, I guess, food insecurity in terms of what are we measuring, how do we measure it, the significance of the measurement, what will we be doing with the results, et cetera.
To the chair, I'm going to have Dr. Finkelstein step in. I think your question was around When this tool is launched, how are we going to be measuring, I guess, how it's used or what impact it has?
Yeah, this is the second time you've asked about my questions. Let me be more clearer then, if it's helpful to you. I'd like to have an understanding as to the measurement in terms of it's something you're going to be measuring, you're going to be testing. How do we validate then the results, and how do we measure what the impact of this? It's a pilot program that is actually going to be in place, and the results of that, how do we measure? Like, what's the benefit? How do we test the tools in terms of compliance, for example?
Through the chair, thank you for your question, Councillor. I'm going to ask Associate Director Thompson to answer about the specifics about the food safety management plan.
Good morning, through the chair. With regards to the implementation, at this time it's purely educational component, as you know, and the report is indicated. With the evaluation piece, at this time we're looking at just getting feedback from from the organizers, especially some of the main organizers within the City of Toronto that operate annual events, to see if they are finding out that this information is useful. We do know that there's a number of our large routine organizers that operate yearly. They do, in some cases, exceed some of these components, but we're also trying to focus on some of these food safety aspects for some new organizers that want to come into the City of Toronto, and making sure that this information is useful for them in order to set up and operate a successful event. We know that the city is looking at, with Markets TO, is looking at expanding the number of venues for various events throughout the year. So we just want to make sure that organizers have the information necessary, so that way they can implement an event that incorporates food safety components into their planning stages.
And the effort here is gradually sort of develop and expand to ensure that organizations can actually not simply accommodate, but also the consideration to ensure that safety in foods, for example, is assured, so that makes it better for everyone as a whole?
We know that food is one of the key components of special events across the city, and we've been working very diligently with our vendors that do operate at the events, but we do understand that there's some precautions or steps that organizers can help take to help further enhance food safety at these events and make them great events for all the people that are attending.
So the current situation in terms of how, so I started the Taste of Lawrence. It's a big festival in Scarborough, and the Board of Health folks come out and they test it, and this is something that is very welcome. But for smaller organizations, for example, when you talk about the work to be done, they don't have enough resources. Is there any proposal to find ways to assist them with respect to resources as part of the work that has to be done in an administration aspect?
Yeah, so through the chair, what we're looking at is actually resources that, one, will help educate them into itemizing some of the food safety aspects into their plan, but through the development of an online tool that's been created to actually assist them in the actual writing, so that this does not become a burdensome task for those organizers, because ultimately this is not a writing campaign that we want them to go on to. We want them to understand the importance of food safety at the events.
Fantastic. Thank you very much for both understanding the question that I've asked you and giving me a response, and thank you very much for your response.
Thank you. Thank you. Any other questions? Seeing none. Any speakers on this item? Seeing none. Go ahead, Councilor Thompson.
Thank you. I just want to congratulate the staff for this report. I think it's great, quite frankly, in terms of the overall desire to enhance food safety. As has been stated, many of the events across the city, food plays such an important role, and all of the different diverse ethnic foods that exist in the city. And sometimes when we look at perhaps places around the world, the way some street foods, for example, are handled, we would never imagine, we would never allow them, first of all, happen here in our city the way it's done elsewhere, and maybe that's part of the protocol and that's part of the flavor and so on coming into the country. But being here, there's a real desire to ensure that people are safe, they're not getting sick from the food. And I think it gives great comfort to those who will participate and attend various festivals and events across the city. And it's also important with respect to understanding how we will measure success from this program in terms of compliance. Is the overall safety of the foods, is that at a higher level versus other sort of benchmarking and so on. And I think it outlines a very positive approach in terms of those who would go to these varying events and the quality of the foods, as well as the FSMP, which I think is extremely important, the Food Safety Management Plan, as part of the application process. I think we do that now with I know we do that now. If you're going to use one of our parks, you have to put a solid waste plan together, you've got to put a safety plan together and so on. And I think that it's extremely important that we add this additional element to those events that are taking place in the city. So I realize that it's not going to be tomorrow or next week, but it's going to be sometime down the road. But I do think the direction of accountability is an appropriate one that we're actually taking. So again, thank you for this work. I can move that item if no one else is speaking.
Wonderful, thank you. Moved by Councilor Thompson. All those in favor? Opposed? Carried. Okay, so it looks like, is my motion ready? 1 second.
I just sent it to Dr. Lynch.
Yeah, sure. Yeah. That's great. Thank you.
Yeah, just let them know. Point of order, Chair. I'm also working on a motion, and I just wonder, could we go into camera first and then come back with any?
Sorry, which motion are you referring, which item are you referring to?
To the feedback from Toronto Public Health Homelessness Working Table.
Okay, I just had legal look at mine, just make sure it's in order and everything is fine. So just make sure staff takes a look at it first.
Yes, I am.
I will continue to hold it down.
Thank you very much.
Thank you. Okay, in that case, then we'll go to item 6. So we'll have to go in camera for that. Item 6 is HL 21.6, anticipated service impacts for Toronto Public Health and emergency responders due to the closure of safe consumption sites in Toronto. You good?
If that's okay.
Yeah.
Will I be let back in?
Okay. That the Board of Health recess its public session to meet in closed session to consider HL 19.6, anticipated service impacts for Toronto Public Health and emergency responders due to closure of safe consumption sites, as it pertains. As it pertains to advice or recommendation communications that are subject to solicited client privilege and information about litigation or potential litigation that affects the Board of Health. All those in favor? Opposed? Carried. Thank you.
Hello, everyone. This is the Board Secretary from the City Clerk's Office. I'm just going to read a statement for those who are connected remotely via WebEx. The Board is now going to move into closed session. We will first suspend the live portion of the WebEx live stream. Anyone that is not needed for the closed session is asked to disconnect from the meeting. If you need to address the Board after the Board returns in public open session, Please monitor the meeting on YouTube or on toronto.ca/council and reconnect once the board is back in open session, using the same meeting details that were provided to you earlier. If you do not disconnect on your own, you may have difficulty reconnecting to the meeting once the board returns in public open session. we're back in public session.
Yeah, thank you. We're back in public session. We are going to move a motion to extend the meeting beyond the lunch recess, that the Board of Health extend this meeting past the scheduled 12:30 p.m. lunch recess to complete the agenda. All those in favor? Opposed? Carried. Thank you. We're now Okay, we're back in public session. Thank you to those who waited online. We're now going to go back to item HL 21.5, feedback from Toronto Public Health and Homelessness Working Table. We do have some motions on this item. So which item are you going to put up first?
If you want to start with item 5, you can start with speakers to the item, so then the board members can introduce their item.
Thank you. So we'll start with speakers on this item. Who wants?
We need to call the public, registered public speaker. We have a deputy.
Oh, sorry, yeah. 1 second.
So we have a deputy.
Okay, thank you. On item 21.5, we did have one public speaker, Dr. Sue Mee, Executive Director from Street Haven at the Crossroads. Are you here? Not online and not in the room. So now we'll move on to speakers on the items. Who wants to speak first? I know that, Councillor Thompson, you want to speak first on the item? I know you have a motion.
Sure, why not? Yeah, maybe just get the motion up. So, again, I want to thank the Homeless Working Table and the folks who came in to present for this report. I'm moving the following motion, requesting that the Medical Officer of Health shares the report with the City Manager for consideration with work that's being done addressing the city's acute homeless issues to support implementation of the recommended actions from the Health and Homeless Working Table in the attachment 3. There is a lot of challenges, obviously, in this area, and there are numerous elements associated with this. We've heard about refugees, we've heard about asylum seekers, and a variety of others, and obviously local residents who are challenged with respect to needed accommodation and so on. What I find rather problematic, and I know that the group, the Homeless Working Table group, didn't spend much time in terms of addressing the issue that we saw at 129 Peter Street a couple of years ago, and a matter that was at City Council most recently, where it was essentially buried because folks didn't want to discuss the issue. The Ombudsman's report itself and its recommendation, for the very first time in the history of this city, an accountability officer's report was basically not accepted by the city manager, and the recommendations were, again, not accepted, strong recommendations as they were. And I won't talk about the sequence of things that occurred at City Council and Council's attempt to avoid discussion with respect to the Ombudsman's report. But I will say that our own policies as a council was not followed, where the mayor moved a motion indicating that 2 items would be discussed as the matter would be held second day of council. The matter, one of the 2 matters, the Ombudsman's report itself, was conveniently moved as a quick item in violation of City Council's own policy. And I find that then, and I find that now, to be acutely problematic, in fact, shameful. So I'm asking the city manager to look at the recommendations that have come through this Homeless Working Table group for consideration, and I'm hopeful that he will find it acceptable to be added as part of the work that he and his staff are doing to address this particular issue. I find it also rather interesting that given the media as well as the challenge that existed for these African refugees who came to the city of Toronto and were essentially forced to fend for themselves in the heat and the rain and the strain of the conditions at the time, that in fact, information as it relates to this group in terms of the effects and the challenges and the problems that we're having, and of course the city's interaction in terms of trying to demonstrate to the federal government, look what you've done, it's not our fault, it's your responsibility, it's your issue, that this matter would not have been brought forward to this group, whether or not it's by the city manager's office or anybody else, quite frankly, because this was a major issue in the city. So while we have acted not only as a council shamelessly, we've acted as a city shamelessly as well in terms of the effect on these particular individuals. And so today, I'm hoping that the city manager will find the recommendations from this group accessible and acceptable for the work that he's doing. So I'm moving this motion for that reason. Thank you.
Thank you. Councilor Bravo?
Thank you, Chair. I also have a motion in reference to the questions that I asked earlier around access TO and the city's policy to not ask about status at point of entry because of the numbers of undocumented people that are in our city on a continual basis. So this is a request that we affirm as a board that Torontonians who are undocumented without status experience unique vulnerabilities and within the intersection of health and homelessness under this policy. And I want to just highlight that this is a population that is exceptionally vulnerable to exploitation, abuse, and has no protections under the law. And yet there are so many different ways to become undocumented. First of all, people whose asylum claim or is denied may end up in Canada permanently. And the many changes that have been made by the federal government to visa requirements for different countries, to invitation to have international students come massively to pay high tuition so that it can subsidize our post-secondary institutions, to the policy that was advanced by the business community, by big corporate interests to have a massive influx of temporary foreign workers whose visas or work permits will now expire, and who have invested massive amounts, including through recruiters who brought them, only to find that here they have no rights as workers. So I think we're facing really difficult conditions in the coming future, and we have to really hold firm on this policy and understand where its origin is found. I also want to just draw attention to the motion that Council adopted in December, which I moved with respect to our shelter plan, which essentially set out the accelerated expansion of a specialized refugee shelter and housing options that would be complementary to the emergency shelter system. I want to draw attention to the imminent threat of the changing rules that the federal government has brought in, which will take effect at the end of this month, which essentially starts to cut into the available funds to compensate the city for operating a refugee serving shelter system, which has historically been a federal and provincial responsibility, but the City of Toronto has agreements with the superior orders of government, in this case the federal government. The proportion that they'll pay will increasingly be reduced eventually to 50%. And the numbers of people who will qualify for assistance will be drastically reduced as well in relation to whether they are, the refugee claim has been accepted, where they filed their refugee claims. So it's going to end up leaving many, many thousands of people unprotected. the work that has been ongoing with the refugee serving sector that certainly I was doing throughout the crisis when people, even before people were sleeping on the street, and I learned of the city's policy and the dangers that it would bring. I think I'll be supporting Councillor Thompson's motion because I think there's important answers to be found and information to be brought forward. And I understand that the chair has a motion on the outcomes for incarcerated people post-incarceration. I'm not going to move a motion on this, but I would say that there's really important factors that this table could consider, including the impact of having been in the child welfare system, which is a really important driver here that we recognize and we see repeatedly when at the age of 18, people who have been under care of the state are essentially abandoned to their own devices, and that most significant population that is currently unhoused or within the shelter system are survivors of that system. And I'm not sure about the other motions that are coming, but I appreciate the chance to move this one. Thanks.
Yeah, thank you, Councillor Bravo. Councillor Chang?
Thank you, Chair. I have a motion, and it's very simple. It's just to ask for a report back in a year to see the status of these great recommendations that we have, because I think these are things that, and I'm grateful for Councillor Thompson's motion that will highlight these recommendations to our city manager. And I think, you know, when we have such good recommendations, sometimes they disappear into the many processes that govern our city. So just wanting a report back so that we can see how these are progressing through our system. Thank you.
Thank you, Councillor Chang. And I do have a motion as well, as mentioned. It's around the federal government, or asking the federal government to look at proactively looking at discarding, expunging convictions of people who've had possession charges for cannabis. We know that Black people, Black men in particular, and Indigenous men have been affected by this more so than any other group. And we know that, you know, one former Toronto police chief who was all about law and order made sure that every person that was ever caught with cannabis was charged and went before the courts. And of course, we also know that the same former police chief have made probably millions from this when it became legal. And I find this very vexatious, quite frankly, and just immoral in so many ways. And now the system as it stands now says, well, if you proactively go into the court and ask for your name to be expunged, then you know that it will happen. Well, quite frankly, I think the onus should be on the courts, on the legal system, to expunge people proactively. In some cases, people probably even forgot that they have a charge, depending how young you were when you first got charged. Many people who are underhoused and on the streets and in the parks, it's a result of not getting employment that they are where they are today. This does have generational effects on people and trauma. And so I feel that, you know, we owe it to those members of society to actually go out and make this, turn this wrong into a right. I mean, quite frankly, I think they should be compensated themselves. But you know, that's another story altogether. Maybe that's going to be my next motion next month. But for now, I think that is something that we should look at, and not only just send a letter to the federal government, and perhaps even to the province, quite frankly, but we should follow up with them as councillors when we meet with them at various organizations. For example, I'm part of the Federation of Canadian Municipalities, and when I sit at that table, I will bring it up there. We're now part of AMO, I'll make sure to break it up there as well. And I think more voices at the table on this issue will make a difference. So I'm going to be the champion in this one for now. I will, go ahead, Councilor Thompson. Is your mic on?
Sorry, 2019 Bill C, Bill C-93 that was passed, was that not intended to do the very thing that you're hoping to achieve?
So when I spoke to staff on this, they mentioned that if an individual goes to the courts, then it will be expunged. I'm saying that
You have to take proactive action.
you have to take proactive action. My motion
is intended on just summarily, arbitrarily, that they would just remove the charges?
Well, my motion is actually saying to the government that they should go in and
Just to remove it altogether.
Remove it altogether. That's my intention.
Yeah.
Then take steps to expunge their record when they consider those records.
Thank you very much for the clarification. I appreciate
Thank you. So the motion reads, the Board of Health requests that the federal government consider a proactive cannabis record expunging for convictions of simple possession.
Right.
So again, it's the proactive piece here I'm focusing on.
Got you. Thanks for the clarification.
Okay?
Bye. Thanks.
So I will move the items on the order that we put them up. Do you need to put them up again, or?
I'd like to have a recorded vote.
Okay. Okay. Recorded vote on Councilor Thompson's item.
That the report be widely circulated. All in favor? I'm in favor.
The clerk has to call the names. I don't know. I've only been here forever.
All right, on Councilor Thompson's motion, Councilor Alejandra Bravo, how do you vote?
In favor.
Abinaya Chandralabin, not present. Councilor Lily Chang,
In favor.
Councilor Parthy Candavel, not present. Lindsay Kretschmer, not present. Ida Lapredi.
I'm in favor.
Oh, my apologies. Can you repeat that, please?
In favor?
Councilor Chris Moyes,
In favor.
Charles Ozoud,
In favor.
Councilor Anthony Peruzza, Suman Roy,
In favor.
Ramanjit Singh, not present. Councilor Michael Thompson,
In favor.
Stephanie Dow,
In favor?
okay, that passes unanimously.
Okay, thank you. The next item is Councilor Bravo's motion.
Can we just have a voice vote now?
We are, it's a voice vote on that, yes. All those in favor? Opposed, carried. Here we go, that carried. Next is my item. All those in favor? Opposed, carried. And as amended. Oh, Councilor Chang, sorry, Councilor Chang's motion. All those in favor? Opposed, carried.
Give us a moment to put it up there.
It came up, I think. I saw it. I think I did. Okay. An item as amended. All those in favor? Opposed? Carried. Okay, wonderful. So we'll move on to our last item. And anybody who wants to speak to this, or should I just put mine up first? What is the last item? It's the cannabis item. Okay, so I will. It's item number 6, yes, anticipated service, 21.6, anticipated service impacts for Toronto Public Health and emergency responders due to the closures of safe consumption sites in Toronto. And I do have a motion, and I'll ask staff to put it up, and I'll read it And it's as follows. The Board of Health authorized the city solicitor to seek leave to intervene on behalf of the Board of Health in the Superior Court application bearing court file number CV-24-00732861-0000, and to intervene in the application if granted leave by the court, and take any further steps necessary and consistent to give effect to this authorization in consultation with the chair of the Board of Health, or in the chair's absence, the vice chair of the Board of Health. So again, we've been very consistent
Can we ask a few, is there an opportunity to ask a couple of public questions on the public, on the recommendations, the public staff report?
Sure. Okay. I will hold this down.
You know, we've dealt with the confidential stuff.
Yes, we have.
And the legal stuff, but
we haven't asked.
There's a series of recommendations here that are public that relate to this.
Okay.
And I just want to understand what the net impact of the recommendations that are before us today.
Okay, so go ahead and ask your questions, Councilor.
Sure. So we have a bit of a quandary with this because clearly the provincial government action is causing a number of these sites to essentially not be functional anymore because they don't meet the legislative test. And there are some recommendations here which I'm not very clear on. Is it your intention to essentially move some of the services that are currently being offered in these specific sites into our shelters?
Go ahead. Also, too, Councilor Perruzza, I want you to note that in item 1, it says the Board of Health urged the Government of Ontario to, and then there's ABC. But I'll ask the Acting Medical Officer of Health to comment. Go ahead.
Sorry.
To the chair, the intention of this recommendation is to continue to allow access to supervised consumption sites where the legislation permits it to be allowed. So we're just asking the Government of Ontario to expand access where it is permitted within the legislation. So that even if there are some sites that are closing, that there'll still be access at the remaining sites.
But what do you expect the net effect of your recommendation here to be? So someone now technically can bring their own whatever drug they use to a shelter, and if that shelter fits within the sort of or rather is not how do you say, if that shelter is not deemed to be not to be able to be a consumption site, then people will be supervised there. So you're moving those services into some of those places. Is that it?
To the chair, I'll just start and then I'll include our acting director of clinical services.
Yeah, maybe you can describe it just in a simple way, what you mean by this.
So supervised consumption sites allow users to bring their own substances to be able to use them under clinical supervision to intervene and provide safe equipment and also respond if there's an overdose. Those sites are designated. They're only allowed to occur under legislation, and in Toronto we had 9 and 5 are slated to close. So they are not necessarily in shelters. Many of them are in sites like community health centers and other clinical sites. So In the legislation, the sites that are set to close are those that are within 200 meters of a daycare, childcare center, school, or private school. And we don't have assurance that as those sites close, that additional sites will be allowed to open or that there'll be increased support to the remaining sites. So we're encouraging within the context of the legislation where it's permitted that access be enabled so that even as you close some sites, clients can still get services where they need it. Is there anything you'd like to add, Sana?
Through the chair, yes, Dr. Lamte, you covered it. I'll just add that in order for a new site to open, we do have to request an exemption. So the province would have to approve any new sites. And so that's the other piece of this, is that we couldn't reopen another site at this time unless the province granted us an exception.
So then, but you don't have to ask for the exemption to move the services?
You do.
We do. An exemption is tied to your physical location. So if we were able to continue operating services at the works and we were just moving sites, we would still be submitting a brand new exemption application tied to that new physical location.
And do you need to request an exemption if you're going to expand the services at the 4 remaining sites?
Through the chair, if I understand correctly, if we have a new site and we'd like to add supervised consumption, would we need to apply for an exemption?
No, but 4 are going to continue, as I understand it, right?
Right.
Okay. If you, the question is, if you want to expand the services at any one of those sites, do you need to request an exemption there as well?
Through the chair, that is a good question. I'm not familiar if they would need an exemption to expand hours of operation or expand their number of booths. That is something we can look into. They would need additional funding, of course, if they wanted to do that. Those aren't operated by Toronto Public Health, though. Those are other community agencies that are operating those sites. The only one that Toronto Public Health had purview over is the works.
Okay.
Okay, thank you. Any further questions of staff? Seeing none. Oh, Councillor Chang, go ahead. And again, I know these are new board members, and so they haven't been privy to the conversations we've been having over the last several months. So this is why.
Thank you.
So go ahead, Councillor
Thank you,
Chang.
Chair. So I'm just wondering what kind of consultation has happened in the scoping of the heart hubs in our application? Have we included the consultation of all the specialists, including those who are addicts?
To the chair, I'll start by saying, in order to submit the application for their heart hub, there was a requirement to include and list the partners that would be involved in providing the suite of services. So that has included discussions with some community agency providers, as well as some clinical partners in the acute care system, including addiction medicine specialists and the Center for Addiction and Mental Health. I'll ask Sana to add anything if I didn't cover anything.
Through the chair, to add to Dr. Lamte's points, we had approximately 2.5 weeks to submit our application. And so most of our focus at that time was working with our partners to ensure we could build a robust model as part of our application. And we relied heavily at the time on the engagement that was done informing our Health Our City strategy for the city last year. And our plan would be, as we get more information about our funding allocation going forward from Ontario Health, that we continue that engagement and expand it.
And how many hubs will be opening in replacement of the 5 that are the 5 safe consumption sites that are closing? How many hubs are opening?
Through the chair, the announcement at the time from the province in August had been that the sites that are slated to close would be eligible to apply to transition into heart hubs. At this time, we've been told that the 5 sites in Ontario have been approved. And we know that there's other community health centers and partners that submitted an application outside of that model, but we don't have information yet on their application process.
And where will people...
Also, too, there's only one pool of funds for X amount of sites. So I think it's $378 million for all the heart hubs across the province.
And so how many will be in Toronto? Do we know?
Through the chair, we don't have this information confirmed at this time. This would be the provincial decision.
And when are they slated to open? Is it spring 2025?
Through the chair, we've been told that they expect heart hubs to be operational in April 2025.
So would there be a gap upon the closures of safe consumption sites and the opening of these sites? Is there expected to be a 1 month gap, or the same the next day the next thing opens?
Through the chair, to answer that question, the services at safe consumption sites are different to what would be offered in a heart hub, so it wouldn't necessarily be a gap exactly. We do have plans at our location for Toronto Public Health to expand our outreach and ensure our clients' needs are being met through what is allowable within our legislation at this time. But yeah, so since the services are different, it's hard to answer the question with an exact gap.
But I guess someone who is looking for help, and before they might go, and maybe the kind of support they'll get is different, but having a place that they know they can go to where people can care for them, is there a gap in that?
Through the chair, absolutely, that's a good question. What we are doing at our end is ensuring clients are aware of nearby locations that are remaining open. So for example, closer to 277, there would be a site operated by Fred Victor. Of course, they would have limited hours of operation and limited number of booths, so there would be an impact to their operations. We've also been working with our nearby agencies, including St. Mike's Hospital, to understand their harm reduction supply strategy and ensure we can increase their stock as needed, as they do have a vending machine and Sherbourne Health Center. So we're doing what we can to ensure clients are aware. We're expanding our outreach services. We'll include needle exchange on outreach. So those are some of the steps that we're taking to mitigate impacts to our immediate clients. And we will ensure that there's regular outreach right at 277 Victoria, of course, because we expect clients to still return to that site for some time.
So you kind of answered my next question, but just to put it up front, where will people get clean needles upon closure of safe consumption sites? Where are they expected to go?
Harm reduction services.
Through the chair, yes. So we will provide clients with a list of nearby locations to 277 Victoria, so that the clients that are normally coming to our location are aware of where else in the area. And we will also ensure that's available in outreach. So during our hours of operation, we are looking into expanding our outreach model and ensuring clients receive supplies through that means.
Thank you. Those are my questions.
Just to follow up on Councillor Chang's last question, harm reduction services or supplies was provided from Toronto Public Health, and the province paid for that. So with the remaining SCSs that will remain open, how do they get their harm reduction supplies if we are not supplying it at Public Health?
Through the chair, so as I shared earlier, heart hubs are distinct to our harm reduction program.
I'm aware of that.
So that work will continue. So we will continue to support agencies in receiving harm reduction supplies through our contracts with them. So that work will continue.
Was I misinformed when maybe I misunderstood that heart hubs are not permitted to provide harm reduction services?
You are correct. We cannot provide needle exchange services and harm reduction supplies from our heart hub location. However, we could still provide supplies to other agencies that we're contracting with, so it doesn't have to be out of our heart hub location. That is the distinction that the province has made, that needle exchange can still be done, it just cannot be done inside a heart hub.
Okay. Yeah. Thank you for the clarification. Any further questions? Seeing none, we'll go to speakers. And I was speaking on my motion, but I've lost my train of thought. Yeah, so again, we've been very consistent at the city from day one when we found out about the closures of supervised consumption sites. I did introduce it initially. Do it again. Can you put it on the screen? So the motion really speaks to.
I just wanted you to be able to make sure.
Okay. But first something at you. Okay, so my motion really speaks to joining the court challenge as an intervener if granted leave by the courts. We've been very consistent from day one as to where our stance is around safe consumption sites or supervised consumption sites. We believe that it's an important tool when it comes to addressing addictions. We need to support people where they're at. We've also said from day one that we support hubs. That's one of the tools in regards to addressing addictions. Supervised consumption sites is another tool that we use to address addictions. We need to support people where they're at. I've mentioned many times that, I've started my career as an addictions counselor at one of the local hospitals. And I remember way back when we actually had to educate people on the importance of not sharing needles and show them the stats around increased Hep C and HIV. And that, yes, harm reduction kits, they come with 10 or so needles so that people can actually use in a group, but in a safe way. Dr. Lamptey alluded to that earlier as well, because we know the habit is people use with friends. And so it's unfortunate, fast forward to 2025, we are in danger of removing that option for people to use safely, and indirectly saying to them, go ahead and share needles once again. After years of building that trust and relationship. I've also learned to, going into safe consumption sites and speaking to the staff and the clients and even community, that there is community within community. These are the most marginalized people in our communities, and they build relationships with the staff at supervised consumption sites. There's a relationship there, there's a trust there, and it's quite sad to see that may be broken. Because I think, once you break that trust, then it's hard for them to actually engage again later on. And this is why we're trying so hard to actually say to the province, this is not a good way forward. Let us continue to support those that are in need and in crisis. And it's a crisis, I think, to a degree that we've actually created as a society, right? When it comes to homelessness, right? People who initially become underhoused are not usually addicted to drugs. They actually use drugs to stay warm and to overcome a lot of the challenges that they experience outdoors. And so we as a city are doing all we can to build more housing and provide more supports, but we cannot do it alone. I've always said, follow the science, and we need the support of the province to come on board and help us to actually help those who are most marginalized. I think we succeed as a society together when we do that. And we also know that it's actually cheaper to house people than to actually have them go through the medical system, through the hospital system, and the wait times and everything else. And talking to various agencies of the city and even our partners in the healthcare field, they are concerned as to what's to come. I am concerned that our emergency services, be it paramedic, fire, and police, they will be inundated. We'll see more needles in our laneway and our school grounds and elsewhere. And not to mention what will happen to our emergency departments and the wait times there. It's a perfect storm, quite frankly. And so this is why we're trying to, slay this and keep things moving as it has been. And I think safe consumption sites, based on the data that we have in front of us, have shown that it has worked and continues to work. And even the Chief Medical Officer of Health's report last year said that we need more safe consumption sites, not less. And I think that's one of the reasons why the province have actually stepped out and find their own legal teams outside of their own in-house team, because there is conflict there. So anyways, we will continue to do what we're doing here at the city to try to support the TNG group and others who have really championed this fight in the courts. And those are my comments. Councillor Thompson, go ahead.
Thank you. With respect to your remarks, your position on the province's decision to seek outside counsel, you have no evidence that that's in fact the position of the province. This is just your opinion. Is that correct?
Sorry, can you repeat that, Councillor Thompson?
Sure. You stated in your remarks that you thought that the reason why the province is getting outside counsel is that the assumption is that internally there is another belief, and so they're moving outside. Those are your remarks.
I believe that.
I just wanted to make sure that I understood that this was just your opinion, not that you had any inside information from anyone.
It is my opinion only.
I just wanted to help you, actually.
Yes, thank you. I appreciate that. Thank you.
Thank you.
It's my opinion only. Any further questions? Comments on the motion?
There's two additional.
Okay, according to the clerks, we have two additional motions. You want to put up motion number 2, and it reads, the Board of Health direct that the confidential attachment 1 to the report, January 17, 2025, from the city solicitor remains confidential in its entirety, as it contains advice which is subject to solicitor-client privilege and information about litigation or potential litigation that affects the Board of Health. And there's a third motion, that the Board of Health adopt the following recommendations in the report, January 7th, 2025, from the city solicitor. The Board of Health direct that the confidential information contained in confidential attachment 1 remain confidential in its entirety, as it contains advice which is subject to solicitor-client privilege and information about litigation, the potential litigation that affects the Board of Health. Go ahead, Councillor Thompson. Oh, you want to vote? Okay. So let's vote on item 1 first. Of course, this is speaking time. Go ahead. You want to say a few words?
Thank you, Mr. Chair.
Sorry. Yeah, go ahead and speak.
Thank you, Mr. Chair. So I'm new here to the board, and I'm trying to digest this very, very complex issue. But what I believe we have in front of us is, look, you can have clear philosophical differences on approaches to stuff with the provincial government, and we often do, right? But here, what's clear is that we need to find a working middle ground. So we believe in a particular course on this. So our approach is, look, these sites save lives, they're useful, we've had lots and lots of visits to them, it's good public policy, it's good health policy, so therefore we're going to do it. In comes the provincial government, and we are right. and we fundamentally believe we are right. But public opinion and mounts against some of this activity. And I can tell you, for example, in one shelter, not a site like this, in my neighborhood, I was there, and you know, I attended a meeting there, and I'm coming out of the place, and there's this guy in this SUV, right? This, you know, really, really expensive vehicle pulls up in front, and I was dressed. I was on my bike. I attended a meeting at one of our shelters, but we do provide needles to people there, and this guy rolls down his window and he asks me for needles. Hey, buddy, you got some needles, right? To be able to give. So what happens around these places is that you have all of this criminal element that swoops in, that see, you know, and they prey on these folks, and then what they do is they create a problem in that neighborhood, as we had, for example, with one of these sites here downtown where there was, you know, I forget the name of the person who was shot and killed. For example, so you have that activity that comes into play, and then all of a sudden, public opinion mounts against the site, and I'm not sure that so then we sort of give what is, you know, sort of a populist provincial government looking for issues to distract people, you know, whether it's on bike lanes or things like this, to come in and say, well, you know what, we're going to deal with this for you, because you don't have the capacity to do it. You don't have the wherewithal to sort of include you know, communities in that mix. So we're going to deal with this social issue for you. And that's what we've allowed here. I think that's how I read it, and that's what's happened. And I'm not sure that the recommendations that we have in front of us move us to a middle ground with the province on how it is that we take care of people's health, how we do the kinds of things that you talked about, right? But at the same time, right, address the concerns that are being raised by the province around community reaction to the issues that they are faced with in dealing with these centers. And in dealing with sort of all of the added, you know, activity that some of these centers generate, and the impact that it poses to people in those neighborhoods. So I think we need to. I think that we need to do some more work with this, and we need to think about and work towards. You know, those middle grounds, and I don't know what they are. I'm not an expert here, but this doesn't do it, and I don't think that this gets us there, and I don't think that this gets us to a better place with either the province or the public in terms of how we deal with this very, very acute social problem in our neighborhoods, and we deal with people's health.
Yeah, thank you, Councilor Bravo. Go ahead, 5 minutes.
Thank you, Speaker. I will be supporting, sorry, not the speaker yet, but the chair. I'll be supporting the chair's motion. I think that Councilor Perruzza raises really important questions of politics and administration of a policy. And that's certainly something that politicians need to consider, and also as we reflect on the work that was done to study the particular site in Riverdale, which there was the province appointed someone to study what went wrong there. And clearly there was work that was needed that wasn't being done, or supports that were needed that weren't provided in that community. And that's important to remember and to lift up. You know, I think about what this policy does, of what this position does, for example, around harm reduction. If I can be personal about it, like for my kids, say like 25 years ago, going to the playground to pick up needles in my neighborhood, and my kids going to parks all over my ward to pick up needles. with insufficient gloves and having parent volunteers and community volunteers do that. I feel we're going back 30 years here. In addition to grappling with the changing situation of just the toxicity of the drug supply, the lack of urgency around handling that, I think having the community-based response is how we got here. It was in the city of Toronto, largely in other cities where people were tired of seeing or couldn't tolerate anymore the numbers of deaths. And I think that our lens and our obligation as members of the Board of Health, just no matter how politically complicated and unpalatable it could be for all of us, and who are accountable to large constituencies, is that we have a very specific mandate here. There's a vision and a mission and a mandate to protect people at a population level. And if you consider what we've heard already, which is that you can't even compare how many people are dying from overdoses compared to the impact and the ravages of COVID. And yet we had an all-of-government response around COVID and protected people and young people sacrificed to protect elders. We've gone through a big trauma around that, and there's real consequences, particularly when it comes to youth. In this situation, we have community partners, constituents who live in all wards, every ward in the city, who are looking to us to use every tool that we have to make sure that the health of people, the best possible outcomes, reducing the inequalities among the people who are most impacted is something that we have to take up. And in this situation, I think supporting the chair's motion to intervene and to, if that is deemed acceptable by the courts, is what we need to do.
Thank you, Councillor Bravo. Councillor Thompson.
So, Mr. Chair, I'll be supporting your motion, but I'm not supporting your motion with respect to the perspective of pointing a finger at the province. I'm supporting your motion because there's a necessity, clearly, to ensure that we protect people who need to be protected, and that we know that there is an epidemic of individuals who, for whatever reasons, require the use of varying psychedelic drugs. And we certainly want to ensure that they're protected in this process of their utilization. I do think we need to remember, and there's a big outcry in this city where a beautiful woman was killed in this city through no fault of her own, simply doing what most of us would naturally do, walking with a friend, going for lunch, or having just finished lunch. And there's a huge outcry from the community about this incident. And of course, we had had other situations in our city where neighborhoods and members in the community have reached out to the city, not to the province, to say, hey, there's a variety of things that are taking place in my community, and I'm very, very concerned. I'm concerned about the safety for myself personally. As the individual express themselves, I'm concerned about the safety of my community. I'm concerned the safety of my children. I'm not aware that the city produced a mitigation public safety plan to assure members of the public of their efforts, of the efforts to ensure that they're safe and their communities are safe. And so we've had the outcry of the community to say, look, I don't feel safe. These facilities, while it's all good and well that they're designed to help and respond to a need and to provide safety and protect individuals and so on, and you know, we think that's a good thing. However, the impact of that and the sort of dichotomy of that situation in which people who are not participating in these facilities are finding that their own safety is at risk. And in fact, lives are being lost. And we've heard about the criminality associated with respect to the annexing and the connection with respect to these facilities and what have you. Councilor Peruzzo has expressed that. And you deduce that to other elements and other conditions and other situations that are taking place in our city, where we have placed facilities, shelters, and so on without any consultation. We have seen the impact. I can tell you, my ward alone, we have a facility there. It's one of the modular homes that we have put in place, where I was told that there was going to be for women only. And that turned out not to be true. And in fact, we have seen a situation where the residents who are there, their level of mental and other challenges that they're experiencing are so acute that they're all simply in one place. Now, think of the burden of that on the community and the things that we've actually seen in the response through my office in terms of reacting to the complaint. Not one time was there an effort posed by either housing or the operator of this facility to understand the impact to the broader neighborhood. In fact, their statement to me was, our responsibility is only internally. We're not even responsible for an extension of 20 feet or 3 or 4 meters outside of the building. Imagine that. And so people turn to the province and ask the province to intervene and to help. And they've made these decisions, maybe not the right ones, and that's the response here. And the province has said, look, we're doing what we have to do because of all of these things that you, city, has failed to do. So let's not blame the province for our own inefficiency. Let's take some of the blame on ourselves. And yes, do work with the province, with the people to challenge this. But don't simply point the finger at the province and say it's your fault. We need to take responsibility for what has taken place in our city.
Okay, clerk?
Could I just ask all members participating online to turn their cameras on, just to be counted for quorum? Thank you very much.
Yeah, thank you. Any other speakers? Seeing none, we are at quorum. So let's put the motions up. This is our last item, so let's try to wrap up before 2 o'clock. So the first item is by motion. All those in favor? Opposed? Carried?
I'm opposed. LaPretti is opposed. Sorry. I just want to be.
Okay, LaPretti is opposed.
Thank you.
Okay. No, it's fine. Do you want to record a vote or not?
It is recorded. I just voted opposed.
Okay, fine. Second item, all those in favor? Let's post it first. All those in favor? Opposed? Carried. Second item, third item, posting. All those in favor? Opposed? Carried. Thank you. And that's the end of our agenda. Yeah, thank you everybody for hanging in there. See you at the next meeting. Be well. Thank you.